Ladies and gentlemen, good morning. Welcome to the second day of 2024 World Table Tennis for Health Congress. Before we proceed with today's agenda, let's take a moment to revisit the key points from yesterday's sessions. The day one of the Congress comprised a variety of themes, including UNESCO's Fit for Life initiative, promote inclusive physical education and active aging with table tennis, including insights on how table tennis has a positive impact on brain and cognitive health, also including therapeutic potential for Parkinson and practical approaches, and Francine Parkinson's annual conference. Yesterday's agenda also included the announcement of Zoran Primorac as a newest ITTF Foundation ambassador. The seven-time Olympic takes on a new role. He is ready to be committed to promote the positive values of table tennis, especially its benefits for health. Now, we will focus on more engaging sessions on topics like active aging and Alzheimer's, building a legacy for health through table tennis. Before to start today, I'm also to thank you all around over more 150 participants online of our Congress. So first of all, we welcome Juana Wimansel, working head of Unity Physical Activity Department of Health Promotion of World Health Organization, to talk about implementing aging, active aging, in an online presentation. Juana, you can take the lead.
Thank you very much, and thank you for inviting WHO, to share some of our work in physical activity. I'm a technical officer in the physical activity unit, which is part of the Department for Health Promotion at WHO in Geneva. I'm just going to make sure that I can share my screen. Just a moment. And I hope that you're able to see my slides now. So I think you're probably very aware of the multiple benefits across the life course that physical activity gives us. And I have no doubt that you've already been discussing many of these in terms of the benefits that table tennis can provide as well. In the left-hand column, we see those classic non-communicable diseases that we know that being active throughout the life course will help to prevent. But in the middle column, I've really drawn out some of those vital aspects of physical activity in helping to prevent falls in older adults and maintain physical function. Very importantly, to support mental health, both throughout the life course, but really vitally for older adults in particular. Cognitive health and learning outcomes. Learning outcomes are really important for children, and one of the ways in which being active at school helps educational attainment. But I also think there's a really important aspect in terms of social connection, preventing isolation and enabling people to partake in something that they enjoy, that's fun, and through which they can meet and exchange with others. And to support that work, WHO developed a global action plan. Really, this is a roadmap to guide country action to support and encourage physical activity. And this was endorsed by all countries in 2018 at the World Health Assembly and proposes 20 different policy actions that we can undertake. All of those towards reducing the prevalence of physical inactivity by 15%, a 15% relative reduction. And those strategies sit across 4 different areas, as you'll see just briefly outlined in this slide. We're looking to change social norms and attitudes. And I think there in particular, changing some of the attitudes and social norms about older adults being active, to ensure that the environments, the places and spaces are available to support and encourage physical activity, and make sure that programs and opportunities meet the needs and interests of everyone in our countries, everyone in the population, be they women or girls, older adults, people living with disability or with chronic conditions. And underpinning all of that, the importance of having governance and policy enablers to allow these things to be implemented. The Global Action Plan takes a whole systems approach, recognizing that not just one intervention is going to change everything, and that any intervention or program will interact with others. And so we have this diagram to represent that, the way that different programs, different initiatives might impact on others within that system. And we also know that the cost of not acting to increase physical activity is a heavy cost. This is a calculation that was published in 2023. It was included in our 2022 Global Status Report of Physical Activity, and has calculated the preventable new cases of NCDs and mental health conditions that could have been prevented if people were more active, and the cost of diagnosis and treatment for the first year only to the public health system. And so in that decade between 2020 and 2030, we could expect 500 million new but otherwise preventable cases of NCDs and mental health conditions. And the cost would be about $27 billion a year. And that's a very conservative cost because it only really takes into account the first year of treatment. We know that people with a chronic condition, whether it's hypertension, diabetes, or dementia, will very likely over time develop further chronic conditions. And so the cost of treatment will actually escalate, but it's very difficult to apply that. And that data was presented, as I said, in the Global Status Report, but it actually used the prevalence estimates that we had at that time. This year, in June, we published new global comparable estimates of physical activity in adults, and we'll obviously need to redo that calculation. That data was published in the Lancet Public Health paper. The QR code there will take you to that paper. And we also made a summary report at WHO, looking at the different levels of physical activity in adults across the world and some of those patterns that are very interesting. And that's what I'm going to share with you now, focusing in particular on older adults. Sadly, the data isn't very encouraging, and the prevalence of inactivity has risen. We're now at 31% of adults who are not active enough to get those health benefits. And that's up 1.8 billion people missing out on the many health benefits that they could achieve. Globally, we look at that pattern, and we can look at this graph. If you look at the top bars, the green bar is the average for both men and women. The blue bars are for men and the yellow bars are for women. And you'll see straight away that there is definitely a pattern where women are more inactive than men in most of the regions. These regions that we have down the side, these are not the WHO regions, but rather country groupings that are part of that Lancet Global Health paper. And they take into account not just geography, but also economic levels within a country and similarities. So, for example, high income Western countries would also include not just North America and Europe, but Australia and New Zealand. So the country groupings in many ways make much more sense than just geographical groupings. And with this graph, we can see that some of the highest rates of inactivity are in the high income Asia Pacific countries, Japan, South Korea, for example. And some of the lowest rates are in the small islands in the Pacific, the Oceania region. And I think it's really important to think, why is it that women are less likely to be active than men? Now, we should remember that this is self-reported physical activity, recalling how much activity you've done in the last week. And that difference is really striking. And in some countries, it's more than a 5% difference, really making us think about how we can engage women and girls, because we see the same pattern in adolescents, in being active and making sure that they get enough physical activity for their health. Another really important pattern that I wanted to show you is we've been able to look at different levels of physical activity across the lifespan. And this is just looking at adults. So these are people aged 18 and over. And many of the surveys that we use to calculate this data don't have a cutoff age. So they will survey people within a household of any age. And so that allows us to look at some of those patterns over 60 years of age. Again, here's the graph. This time I'm just showing you by the different WHO regions, which are geographic regions, but we're looking at physical inactivity across 3 different age groups. The 18 to 40s in the green bar, sorry. In the blue bar, we have the 40 to 59-year-olds, and in the yellow bar, the over 60s. And I think you'll see a striking pattern how levels of inactivity are considerably higher in the over 60s. If we look at this by the country groupings that I mentioned before, that are the ones presented in the Lancet paper, we see slightly different patterns, but across all of these patterns, there is a sharp increase in the steepness of that slope at approximately age 60. So here at the top with the red lines, we have men in the different country groupings, and at the bottom with the blue lines, women. The graph
Joanna,
that I have pointed out to you is the one for the global level, and you'll see a line at about 60 years of age and how that line increases steeply.
Joanna, sorry to interrupt. On the top, there's a square that says your screen is being shared. On the right, can you just exit so it gets hidden, please?
Is that
If
better?
it's possible. Yes, it's better, but now it's in the center of the screen. Can you just move it away? If that's okay. Thank you. That's perfect. Thank you so much.
Okay, thank you very much for pointing that out to me. I'm sorry that was there. So as I was explaining, we see that steep increase at about 60 years of age. And that really alerts us to the importance of maintaining some of these promotion activities that we have, particularly in older adults. Because as we know, physical activity actually becomes more important as we age in order to maintain physical function and prevent falls and injury from falls. We also see that levels of physical activity vary by World Bank category for countries, as well as by sex. So lower middle income countries seem to have slightly higher levels of physical inactivity than some of the other income countries. And again, I think we need to explore why this is happening. Is it rapid changes in urbanization, a move from people walking and cycling for transport to using motorized transport? Is it rapid changes in work patterns and levels of occupational physical activity, while at the same time not having an increase in leisure time or recreational physical activity that would compensate for otherwise a sedentary lifestyle at work? This graph just shows us how those patterns have changed over time. We've got data from way back in the year 2000 through to this new data for 2024 that was published. And we can see that the blue line for the low income countries started lower, but is actually taking over now and increasing rapidly. And this also helps us to think how we need to adapt our promotion activities, our programs and opportunities to make sure that we're meeting the needs of all these countries. With this data, we've also been able to predict out to 2030 what the levels of inactivity will be if nothing changes, if we continue with business as usual. And the bad news is that we are off track to meet that target of a 15% relative reduction. And in fact, levels of inactivity will continue to rise and could reach 35% by 2030 if current trends continue and if we don't change some of the actions that we are undertaking. In this graph, again, we look at the detail of that and the detail in the different country groupings. And we can see that out to 2030, the projected value in the yellow bars, there are some countries where that increase is really accelerating, and some beacons of hope. So, for example, in sub-Saharan Africa, it would indicate that levels of inactivity could be decreasing, and also in Oceania. The only caution I would have there is that in many of these countries, we have maybe one, at most two, data points on which to base this calculation. And so there is quite a large margin of error around some of that data, particularly in countries that already have quite low prevalence of physical inactivity. And so we just need to caution that data in the bottom two country groupings, but highlight the fact that whatever they are doing, they need to keep doing so that we can try to bring these levels of inactivity down by our end date of 2030 and thereby contribute to the Sustainable Development Goals. So in summary, the world is off track. Most countries will not meet that global target to reduce physical inactivity by 2030. And it looks like in most places, those levels of physical activity will continue to rise. And so we really call for accelerated action. But there is some cause for optimism. In just under half of countries, we do begin to see a declining trend in physical inactivity. Overall, if we look at the individual lines on each of these graphs, there are some countries where those rates are decreasing. And I think we need to explore further what is happening in those settings and what can we learn from what they've been doing. There are 22 countries that have actually been identified to be on track with a higher certainty. This takes into account the statistical methods that have been used. You'll notice that the vast majority are in Europe, with some in sub-Saharan Africa and some in Oceania. But we really need to look at what's happening in each of these European countries. And we've started to do some in-depth analysis of the policies that they have in place. And I think what's coming out overarching for each of these countries is that they have taken a really holistic approach to improving levels of physical activity. Some of these countries are notorious for having really good cycling networks, for example, and encouraging walking and cycling as a way of active transport. Some countries have got very involved schools that promote physical activity and are promoting physical education. They also tend to have good communication campaigns that raise the awareness of the value of physical activity and then provide programs that really meet the needs of everyone in their population. So I think the message is clear from this data. We do need more action and we need it quickly in order to be able to reach those 2030 targets. And in summarizing that work that was launched in June, we identified 6 key action areas. Obviously, implementing community-wide campaigns to raise awareness, encouraging physical activity through workplaces and that employers could support this, making sure we have a workforce that can provide the programs and opportunities to help people be more active. And we need to strengthen the prioritization in government and make sure that that prioritization aligns with resources to support that vision. But the last one, I think, is the one where you really have an important role to play, and that is focusing on women and in particular older adults. And that goes back to being driven by the data. We see that these two groups are the least active and need extra support in order to make sure that they get the benefits of physical activity. And so I think the work that you're undertaking is really key to support these particular population groups in being more active. This is where you can find more information and the richness of the data that's available. The data is available country by country in the annex of the Lancet Global Health paper. And so if you want to find the data for your country to support your advocacy activities, that's the place to go. And with that, I'll just conclude, just reminding us a little of some of the recommendations that we have, and these are the recommendations that underpin the data. And I think we explained some of this data and some of these recommendations last time we spoke at this event last year, which we were very pleased to be able to contribute to. But in particular, just drawing the attention to the additional recommendation for older adults, and that's that they do on at least 3 days a week varied physical activities that really emphasize functional balance and strength. And to support that, WHO produced a toolkit which focuses on promoting physical activity for older adults. And that has recommendations in 3 key areas: the importance of encouraging older adults to be physical activity. That's through communication campaigns to change those social norms and attitudes. Engaging older adults to be more active by providing programs and opportunities. And there, I think table tennis is one of those key activities that can engage older adults in many ways. And then lastly, enabling, making sure that the environment, the places and spaces are conducive to older adults being more active. And there are a number of different organizations and entities working to support this type of work. Here, I've got an example of the Decade of Healthy Aging, the platform that is hosted by this decade to allow the sharing of knowledge and the engagement across different sectors. And there are ways of getting involved through that platform, through the Decade of Healthy Aging, whether you're representing civil society or whether you're an older person yourself as an individual. Many ways to share resources, share examples of the work that you're doing, so that others can also learn from that. And finally, to close, I'd just like to share with you a short film that was actually a winner in a special prize for physical activity in the last Health for All Film Festival in 2024. This was a prize that was given over the summer by the Director General. There was a whole panel, a jury that chose the winning entry in that special category of physical activity. I think I've clicked the right thing so that the sound comes through, but if the sound isn't coming through, if somebody could please just warn me. But I'll leave you with this short film, which I think you will find interesting.
My name is Nenad Bach. I'm singer-songwriter, composer, producer, and peace activist. I'm performing for the last 40 years actually, but 9 years ago I felt a tremor in the right hand and I said there's something is wrong, and I went to the doctors, but nobody could define what it was or what it is. They said that I'm too sensitive as an artist. But then a year later I was diagnosed with Parkinson. I accepted, and 3 years ago I stopped playing publicly. I wish I don't have it, but since I do have it, I sort of enjoy it because there is a certain beauty in slowness. A friend of mine, Bob, invited me to the table tennis center, and then I was introduced to ping pong, and I started to play table tennis on a regular basis. Then I noticed that actually the next day I moved much better and I felt much better. So I increased the playing to 3 times a week eventually, maybe 6 months later, and I noticed that actually I'm 50% better. And not just physically, mentally also, everything is better than it used to be. I even keep the pedal here next to me, next to bed, so I can play left and right, and it improved me, so I could perform again. Not as good as I used to be, but good enough for my standards to play live. I want to help other people because it's helping me. I hope that everybody who has a diagnosis like me would be helped and play, because they know that exercise helps, but exercise is boring and ping pong is fun. I'm going tonight to play. We have a ping pong Parkinson association. People with the same issues are there, and I can't wait to do that. Table tennis, it's beneficial for me and for everybody with the diagnosis. I didn't conquer Parkinson's with ping pong, but I conquered the fear of Parkinson.
And with that, it just remains for me to say that thank you for giving us this opportunity to share some of our work at WHO, and to thank you for the work that you're doing in really bringing table tennis to older adults, supporting them to be much more active. I took this photo. I was in Jamaica a few weeks ago attending a workshop. I went for a walk early in the morning in the park. And I asked these two gentlemen if I could take a photo, because I think, again, we see how table tennis can be made available to people in all sorts of different settings where they can freely enjoy the joy of table tennis. Thank you very much.
Juana, thank you very much for your presentation, and also to share with us this movie in the end of your presentation. It's so important to know about the clear scenario related to inactivity aging, related to health, financial costs in different regions of the world, as well as the 6 actions of World Health Organizations is implementing to promote activity aging, with focus on women and older adults, implementing community-wide communications campaign, encourage employer support and promote activity places, build a strong workforce, align resources with vision, and strength cross-government prioritization. The key message is, let's be active, everyone, everywhere, every day. Or 1, create activity societies. 2, create activity environments. 3, create activity people. And 4, create activity systems. So I would like to pass to my partner to translate to French.
Merci beaucoup. Donc juste une petite synthèse peut-être en français pour le public francophone. Donc évidemment, on remercie beaucoup Johanna pour sa présentation. Donc en fait, ça nous montre qu'il est très important de connaître exactement ce qui nous attend en termes de coûts, que ce soit au niveau de la santé ou bien au niveau du coût financier, hein, en cas de vieillissement inactif, et aussi de savoir, ma foi, les actions qui sont mises en place par l'OMS, l'Organisme mondial pour la santé. Donc des actions pour promouvoir le vieillissement actif en se concentrant tout particulièrement sur les femmes et sur les personnes plus âgées, comme on a vu dans les documents qui nous ont été montrés, que c'était les deux populations qui étaient les plus concernées par ce problème. Donc, les actions qui sont mises en œuvre, il y a à ma foi l'implantation de campagnes de communication au sein des communautés. Il y a aussi le soutien auprès des employeurs pour les encourager à promouvoir des lieux de travail plus actifs. Il y a aussi, en fait, aligner les ressources et les moyens sur la vision qu'on a du problème, et de manière liée aussi encourager les différents niveaux de gouvernement à mettre en place les moyens nécessaires. Donc le message clé à retenir, c'est soyons tous actifs tous les jours et partout. Donc pour cela, dans la présentation, on a vu certains éléments. Donc ça passe par créer des sociétés actives, créer des environnements actifs, créer des gens actifs et créer des systèmes actifs. Voilà, donc je pense que maintenant, on va pouvoir passer aux questions si jamais il y en a.
So do you have some questions?
Miss Williamson, please forgive me if I don't pronounce your last name well. Thank you so much for your presentation. I was wondering what was the ingredient that we need to add to our activity. And it's something that we daily try to add to our menu, that is fun. So table tennis has this capability of providing fun. Actually, fun is the second objective. The first one is providing safety, especially for older people, because we wanted to prevent falls. Two, to provide more control in people like people that live with Parkinson or multiple sclerosis or dementia, just to have more control in their movements, and to have fun. Now, how do we produce fun? One, it's up to us, to each single individual of us that we practice this sport or we wanted to promote this sport, as a matter of fact, any physical activity, to create an environment of safety and fun. Fun can never, never, never be omitted in our menu. And we need to continue. It's an effort. It's a physical and emotional effort that we, as provider, as promoter of this activity, need to implement, need to have clear in our mind. We need to show to everybody. We need to be the first one to create an example so people will feel comfortable. And when I say people, also, I mean women as well. So we need to make a big effort. Low social classes have sometimes problem in moving, in transportation. So in Colorado, we live in the US, we work with mobility service. So we have vans that go around and pick up these women, especially, unfortunately, because they have MS, on wheelchairs. And sometimes the drivers stop with us and play with us. And they tell us, would you please give us some flyers? Because we take care of many people on the wheelchair. We would like to share this with everybody. I see you guys are enjoying here. So I want to thank you for all your effort with the WHO that you are doing in this activity. And again, it's an invitation to all of us, to do exactly what you're doing right now, to smile. The smile is what is going to create the community. So if I feel accepted and I see your smile, I will share my smile with you. I will share the rest of my life as well. So that intent and the effort to create a community where everybody, especially women, will feel safe, accepted, and part of that group. Thank you.
Thank you very much. And I think you touched on all the key elements there. You know, we need to think about how to improve people's access to opportunities. So you're obviously working with transporters to enable people to come and join your activity, because transport and travel may be a real barrier to many people engaging in something. You're obviously welcoming women and having a particular focus on women. I think many women drop out of exercise and sport because they don't see it as something for them. They don't see themselves reflected in it. Sometimes many of the images that we show with communication campaigns about physical activity show thin, fit women and men dressed in lycra, and many people, myself included, wouldn't see themselves reflected in that, and wouldn't see that as an activity that they could join and feel comfortable in joining. And so we need to sometimes think how we change some of our messaging to make sure that we're reaching the people who really need our programs and our services. But you really hit on such a vital point, and I think fun, enjoyment is what sustains a behavior change. And we know that very clearly, that if you're trying to do an activity that is difficult, that isn't enjoyable, with people that you haven't been able to connect with for some reason, then it's really hard to keep that going. And fun, and that element of fun, I think, is a key part of any physical activity program, and keeping people engaged with something. So I'm really happy that you're able to provide that. And I think that should be at the core of all the work we do, making sure people are having a good time.
Thank you, Juana. Thank you so much for your participation with us. And thank you, all of you, for attending the first presentation of the day, in special who is participating online. We have more than 150 participants from around the world with us. Now, for the second round of presentation, I invite Leandro Olvec, Director of ITTF Foundation, to present the collaboration with Table Tennis Connections.
Thank you very much, Thaisa. I am very proud to introduce the next presentation, because it's a result of a long-time collaboration that we had with Table Tennis Connections. And I see some similarities with the situation when the ITTF was bringing to the ITTF family, bringing the family of para-table tennis, or table tennis for the disabled, some 20 years ago. And when we wanted to promote the activities for people with a disability, some reactions from the National Table Tennis Association was, okay, we want to deal with people with a disability, but what should we do? How do we do it? And after 20 years, the fusion or the implementation of para-table tennis events and development programs is going very smoothly. We have a similar situation now, bringing to the ITTF family people with neurodegenerative diseases. When we are promoting and convincing the national table tennis associations that this is great, the reaction is very positive. They say, of course, we want to bring them on board, but our coaches need to know what to do and what to avoid. Our people need to be aware how should be the sessions and how can we work with them. So that's why some 2 years ago, we were, I would say by chance, connected with a Peruvian player, very young, that she on her 20s, she got multiple sclerosis, and she met a doctor in the US during a treatment that also had multiple sclerosis and a table tennis enthusiast. We were connected with them, and we were discussing about the possibilities to develop a tangible a resource that could be shared with the member associations, with the clubs, and how to deal with table tennis and people with different neurodegenerative diseases. And I don't want to spoil the presentation, And I would like to invite Antonio Barbera and Bruce Henderson to make this next presentation. An applause for him. Thanks.
Well, good morning to everybody. First of all, let me say thank you to the ITTF, to the president, to the director, to everybody for allowing us to be here with you and to share our experience. Bruce and I came from Fort Collins, and it's a moment of sharing. It's a moment of putting on the table different ingredients, different knowledge, so everybody can pick from that and cook your own plate, following maybe some kind of recipe. As Leandro was saying, 2 years ago, we sat down and we realized that we had more commonality than differences. And if you read our foundation mission, the ITTF says, okay, we want to use table tennis to connect people all over the world. And we want to make table tennis popular, universal, inclusive. Well, we say, Leandro, we are talking the same language. Our mission is really to increase the awareness about all the benefit of table tennis for everybody, everyone. We want to create a community around this movement. We want to engage with people experience mild cognitive impairment. I enjoy playing with a group of Greek participants yesterday. Parkinson, Alzheimer, multiple sclerosis, and also bring science behind this sport. We know people that practice this sport, we know the benefits of that, but it's not enough that I wake up tomorrow morning and say, guys, this is useful for this. We need to prove, to obtain all those steps that everybody now is talking about, the WHO. How does the government can help us? How does the local community can help us? How the municipality can help us? How the federation can help us? Well, and again, we decide to put together our effort and to increase the awareness together. I always say, and I said yesterday, everybody with a brain can play. And it is true. But for now, with this production, with this common product that we want to share with you, we are focusing on specific brains. Brains of people that live with Parkinson, multiple sclerosis, and dementia. So since they, or we, allow me, because as Leandro said, I live with multiple sclerosis, we want to share our experience. I think that sometimes starting from the ground and coming up has a more of an impact on people that may receive our message. It's more powerful. It is powerful. And it's enough to see people playing. Yesterday, I enjoyed so much specific games because of the effort, because of the smile, of the tenacity. So that's what I want to share with you, those personal experiences to start with. These videos are mute. Let me see if I can find my, oopsie. How can I let it play? Let me see where I am, right there. Okay, so we were one of the ambassadors for World Table Tennis Day a couple of years ago when we started working together. And this lady is Dee. You saw that she came to the event with her dog and her cane. And one of the first time that she started playing, she was holding always her hand on the table. You saw the way she was doing the backhand. You see her stiffness. She is a trunk sitting there. She has fear to move. I'm not telling you what her condition is. She's still trying to figure out, what do I need to do? Look how stiff is her arm. So now what I did, I decided to allow her to gain more confidence in her body. And so when she walks, she used to walk like this, dragging her foot, her hip was coming forward. She was not picking up her foot. And so I decided, what can I do with this lady? So I gave her the possibility of feeling her balance forward and start bending her legs. Look what she's doing now. She's the same person that several months prior was holding on the table, was afraid of stepping in any direction without her cane. This is a person that never played ping pong or table tennis. These people are not ex-table tennis player that now live with the condition. They are people that live with the condition. They're now playing table tennis. Let me find the arrow again. Okay, as Leandro was saying, what message can we give to everybody in the world playing table tennis? How do I deal with a person living with Parkinson's? How do I deal with a person living with MS? And we had a long discussion about that is a condition, but the condition affects me in a different way that it may affect you and you. So that's where we put our accent. And you have in front of you two ladies. Wow. One right, one left. They are on wheelchair. Wow. It's the same wheelchair, by the way, that I learned how to use. But they are completely different. Pam on the left cannot move her legs. You see how she moves her forearm now, and I will go back to this forearm. Joanne can lift up her legs, and she has much more power on her forearm. Look at the way she sends the ball back. Now, none of them used to play table tennis. And if you guys are players, you know exactly what's happening with this elbow, with this wrist, with the location of the paddle in their body. So we are talking about sensation. We are talking about proprioception. Champions in this sport, they know that they need to go down because they know where the paddle is. They know where the floor is. They know where their knee is. They know where their elbow is. They do not know. Because in this condition, this thing that we call proprioception means the knowledge of the part of my body in the space may be affected. So let me take you back to Pam. Fine. The first time I met Pam was in a cafe on Wednesday morning where people with this condition meet. And I invited her to come and play. And she looked at me and told me, "Don't you see me? I am in a wheelchair." I don't see any problem with that. I mean, your brain is there. Your arms are there. What's wrong with you? We do not pamper people. The first study that we are writing now, we are publishing on 26 people with the Parkinson condition. The neurologists I work with, they asked me, they told me actually, "Antonio, don't you think that for the first time, we don't bring in people in wheelchair?" And I asked, why? They didn't answer me. They had no answer. So we, as physicians, sometimes, we are limiting people. We are treating people not with full respect. And we have too many bias, especially in the medical community. So that was the first time I met Pam. Look how her forehand is shaking. Her grip is miserable, which means she cannot grip well. So I had to feel these things in my hand. I say, "Pam, please smack me. Let me see how much power you have. I need to learn about Pam. I don't care if she's on a wheelchair. She's a specific person in the wheelchair. She's a specific person, an individual with that condition. And now finally I say, okay, I felt your power. Let me see what you can do." She's still shaking. You are going to see later on, she has no idea where the face of the paddle is going. And you don't even know where I'm sending the ball from. Well, I realized finally that I had to sit and be at the same level to feed her. It took me a while, and now she becomes more consistent. And if you can see, I asked her, "Please engage more your shoulder and your core and your pectoral." She cannot rotate well. So how she's going to push the ball? Go forward. She's on a wheelchair. I ask her to engage her core. How? I tell her, "Pam, you feel your glutes in the chair? Massage your chair." You can do that. I don't pamper her. I don't ask her not to do an exercise because she's on a wheelchair. I adapt myself to make sure she will engage her core. Now she's doing her forehand. Look where her paddle goes. First of all, she opens up the face. She doesn't have enough power on this forearm. And now you're going to see the paddle. I'm telling her, "Okay, Pam, I don't see the target. Show me the target." And she goes underneath the table for two reasons. One, because she doesn't know where her paddle is. Two, because she doesn't have enough power. So we need to adapt to her, and we need to encourage her. Now, in time, I learned, of course, talking to her, that she may get fatigued. So I told you yesterday that I always walk myself between, am I overwhelming you? am I challenging you enough? I need to learn about Pam and see how much I can challenge her. I need to be respectful over capabilities. Wade, very stiff. Those legs are two trunks. So how can I stimulate the engagement of the calf? Well, we are using gravity. I say, please push yourself up, push yourself up. Look how stiff this gentleman is. His neck is very stiff. Never played table tennis. We're doing now backhand, and he's holding on the table. He's too tall. He has always this A-shaped frame because he's afraid of falling. Occasionally, he drops his hand and he feels more comfortable. Now, you know better than me that the forehand is much more difficult. So I was inviting him to rotate and timing and come up with his paddle. And I pushed him. I say, wait, you got to move. And I told him, just drag your hands side by side. As long as you arrive there, I'm going to wait for you. And once you're there, I'm going to send you the ball. So I'm adapting this amazing sport to this specific person, and no matter what, he's laughing. So what was I talking about? I was talking about multiple sclerosis. There are almost 3 million people in the world living with multiple sclerosis. If you want to look in a different way, there are 1 in 3,000 people living with multiple sclerosis. How long have I been talking to about? 7, 8 minutes? Every 5 minutes in the world, there is somebody diagnosed with multiple sclerosis. Just to give you another information about this, there is a ratio 3:1 female to male. So women are more affected from this condition. But what is this condition? And I can touch this wire and I don't get electrocuted. Why? Because there is a plastic around this wire. Well, people with multiple sclerosis, our immune system, our white blood cells, our antibodies destroy this protection of the nerve that we call myelin. So this is a normal cell with normal protection. These are my cells that are destroyed. My myelin was destroyed. And we do not know what to do. There's no cure for this. So we take what we call monoclonal antibody medication that keep our immune system low so we don't attack ourselves. But I think this is the most important thing that I want to share with you. You look at me and say, Antonio, what are you talking about? You are walking. You probably may even touch the ball and playing up and down. Well, sometimes we call this an invisible condition. You don't see anything outside. Well, what did you see in these 3 people that I showed you? They had some motor impairment. They had some instability. They were uncoordinated. They had some tremor. We do have tremors as well that we share with Parkinson. We are stiff like a broom. We may have some impairment of our limbs. Wow, what about the rest? That is what our education wants to do. It's not enough that I look at you and I don't see anything, or I see that you're shaking. That's too superficial. If I need to teach you how to use ping pong for your brain, I need to know more about this. You may be numb. Your hands may not squeeze the paddle because you're numb. You are so depressed. You are apathic. You don't have any energy. You have fatigue. When we organize event, we try to schedule in a way that people can rest. They are so excited, they don't want to rest, but we know that they need to rest. We need to provide something that emotionally they say, oh my gosh, I'm fine. Well, they know themselves better than us, but we need to know more so we can apply the same concept to the group, not just to the single individual at this point. So they need to rest. Why? They need to take their medication. Their medication needs to kick in. So we need to provide those things. They are weak. They are very weak. They have pain. We have pain. I have pain right now, but I don't care. I try to remove that. We have cognitive deficit. Well, you see me, right? And we have also problem with speech, with swallowing, that we share many things with people living with Parkinson. So we, provider of this amazing activity, we want to know more about this, especially those things that are not visible. We need to know about that. The day I proposed this exercise, I thought I was crazy. And I told them, guys, you know, I'm crazy, but since I've been working with this community for more than 4 months, I knew they were able to do that. In going up and down, I introduced tempo, because when I asked them to go up and down, they were so uncoordinated and said, so let's start counting 1 and 2 and 3 and 4. People living with this condition, we will arrive to that condition, they don't manage the tempo in the right way. And this lady asked me to correct her on the fly. So we have a robot sending the ball, and I tell her, rotate and come in front of you. I had no idea how to tell her, finish your stroke here. And I asked her, you know who Pinocchio is? Yes. So your paddle cannot come here. Go from the right and finish in front. Oh, my long nose is right there. So you need to see the paddle. So if you don't see the paddle here, means you're engaging your wrist, your ear. So they need to have reference. My reference is, I start from the corner. My paddle stays on top of the table. I start from here and I finish in front where the midline is. And if I don't see my paddle here with the same angle, I'm missing something. It means I'm not controlling that. So it's happening without me controlling that. I don't know, I was talking to somebody yesterday about the gait belt. So look at this gentleman. This gentleman came with his wife that was holding him from this belt, and it was difficult to let him raise from the chair. So we started doing this forehand. He used to play tennis. So we are feeding him, and he's jumping up and down, but already the first progress was, nobody was standing behind him. So even though he has the belt, now he starts moving. He's still jumping too much, so the risk of fall is still there. So we had to reduce his excitement and making sure that he wasn't jumping too much with the risk of losing balance and fall. So I was behind and say, Richard, please control your feet, control your feet. Now he's without belt, and look at, he's moving side by side. This is a person that to arrive at 9 o'clock at the class was going to sleep at 5 p.m. the day prior, so he wasn't too fatigued to arrive. And look what he's doing. What were we talking about? We were talking about, that's the way it's called, but I'm gonna go back to these words, okay? Is the second most common neurodegenerative condition. Please memorize this word for a second. The first one is dementia. And we have 10 million people in the world with this condition. So we gotta do something. And people in this room, if I see somebody living with Parkinson, I do know better than me what Parkinson is. That's really a general knowledge. When we are missing this little thing called dopamine that controls movement and many other things, because this little portion in our brain doesn't produce. It's a neurodegenerative condition. Those cells are degenerating and not producing what they're supposed to. Wow. That's what we see. That's what we've been seeing in our table tennis area. People whose expression is kind of flat, they are stooped, they are rigid, they shuffle, they shake their hand. Is that enough? Absolutely not. There is a world of other symptoms that they are experiencing. They have sleep problems. So then we need to make sure they sleep enough. Emotional change, depression, apathy, they don't want to do anything. That is why we need to propose them a fun activity. That's another important thing. This means that when they stand up, their blood pressure goes down, they are more prone to fall. So when we work with them, if by chance we do exercise on the floor, or when they are, like we witnessed a couple of days ago, there was a gentleman that was freezing too often, and he was on the ground trying to recover. So when we help him to get up, we need to make sure his blood pressure doesn't go down. They are weak. They have these spasticities, muscle very stiff. They have cognitive deficit. They are not multitasking sometimes. So if you tell them do A, B, and C, they may show you that they understood, but they didn't, because this condition doesn't allow them to be multitasking. So break every single instruction or message in a simple way. First thing, you rotate your hips. Okay, get there. Then you touch the ball and follow. Please know about these conditions. Donna. Donna is sending the ball on the other side. Look at her expression. She's very focused on that. She gets very excited. She keeps smiling. That's the most important thing. But oh, I forgot to bring a ping pong ball with me. Do we have any object, small object? Anything, if you can bring it to me. So I realized, of course, that she cannot start the ball. So we toss the ball on the table, and I use the midline, her nose, and her belly button. So I tell people, thank you. So I tell her, use your belly button. Your belly button is home, and touch it. They do not know where the paddle in the space is. So if they go back and touch it, oh, it's here. Oh, I need to bring it here. Oh. So give them some reference. What better reference than my body, than my nose, than my belly? Sometimes I tease them. I say, I want to see a bruise on your belly button. It means you are going back to your belly button. You need to emphasize, so they're going to memorize about themselves. And so we were working with Donna and making sure that she was initiating the ball. How many things in life come from the ceiling or from the sky? Snow, rain. So now we need to deal with this tossing. This is the most difficult task you can ask a person with Parkinson. Why? Because they may have this spasticity called cogwheel spasticity on the elbow. They may not control their power. Their hands can be working a different way. They are rushing to pick up the ball because they need to manage this time and position, time and position, time and position. Their cerebellum, this part of the brain back here, needs to regulate all those things. Cerebellum is affected. So don't provide them, treat them knowing what is happening in their condition. Another gentleman. Oops. Jerry. So we start rotating and doing some forehand. You will see, of course, I try to explain many single things about this, but he doesn't grasp them. And so we're just enjoying this. Rotate, rotate. So sometimes I give them, okay, this is your paddle. You need to look at that wall. Oh, Bob is there. Look at Bob with your paddle. Give them any markers. Say, Jerry, you got to finish looking at me. But Jerry was barely understanding. So rotating, so he's seeing me now rotating on the other side, and he starts rotating on the left. He realized that he wasn't supposed to rotate on the left. And the moment he does, he started laughing. So, oh my gosh. Well, Jerry and Donna are people living with dementia, not mild cognitive impairment, dementia. So how do we deal with people with dementia? First of all, let me give you some information about dementia. We are talking here today about Alzheimer, but Alzheimer is only one of the dementia, and it's the most common. But guess what? We have 55 million of people living with dementia in the world. I don't know how many of us are in the room. 1 in 7 of us, 1 in 7 will get dementia. We don't know which one. People living with Parkinson are more prone to a specific kind of dementia. We with MS, less than the general population, but one of us will get them. So here we come to this joint venture. So we create this Neuropon handbook. You will see, I was thinking to go online and navigate with you, but we have problem with internet. And so the point is this, before we go that, I want to spend 30 seconds to invite you to erase these 3 words from your vocabulary: disease, disability, handicap. Thank you, sir. So we talk about conditions, and we talk about different physical and mental capability. It's not a Parkinson disease, it's a Parkinson condition. And if you are on a wheelchair and you're able to play, that's your unique physical and mental capability that I do not have. If you play with your stick, you have your own capability. That's not a disability. That's very important in approaching this population in the concept of fun and reciprocal respect. So you're going to find this book in which there is index. There are 2 pages of index. In the first page, you're going to find, we're going to talk about a little bit of brain. We need to know about these things. The same way when I ask my coach, show me how to move my forehand. Where do I put my feet? So I need to know more about the brain. I need to know more about the multiple sclerosis, the Parkinson conditions, and the dementia, so I can interact with you in a better way, especially for those symptoms that are not clear to my face. Once we finish this first section, it's going to be a warm-up exercise. And so sorry, I apologize. I missed that. So there's going to be a moment where we're going to talk about how do we create this community around table tennis. We gave you also some neurological information, how to approach these people, and also how we create a neuropong program anywhere in the world. Remember what our mission was. And so now we jump on the warm-up exercise, and we came up with some interesting names: spider on the mirror, finger mates, the elevator, the crocodile. And once you go to page 28, you can pick up, click on the image, and from that image, you're going to go to a YouTube channel where you're going to see this exercise. Second page of the index, you're going to find exercise with the ball. We have the hand scissor, the egg in the skillet, the playing with the hoop. So there's a bunch of exercise playing with your partners. And you can click to the index and go back to the index, to this page and go back to the index. And at the end, you're going to see the personal experience, some drills, the contributor, the scientific collaboration, and the partnership.
Dr. Antonio, I'm going to ask you to speed up, please.
Perfect, I'm done. You're going to see some simple drills that I'm not going to show it to you because they are too simple. And at the end, that's the most important thing, is the personal experience of these people. Those are the people we are working with. And you're going to see their experience and also their progress. In the bottom part, you're going to see some clips of them. And so I want to give you the final message. So I really would like you to grasp my enthusiasm about knowing more about this condition that you eventually will work with. There are not 2 people with MS that have the same symptom. If you talk to the Parkinson population, only 1 person with Parkinson. You have met 1 person with Parkinson, that's the only one. The next person has different symptoms. And please, I had to learn how to communicate with people with dementia. Very interesting. So another effort there. And I want to finish with the words that we share with Leandro. Table tennis is not just a sport. It's a very powerful tool for enhancing the well-being of everybody. But now we are working about these people living with neurodegenerative conditions. And I add, no matter the physical and mental capability, no matter in what part of the world they are. And so we really want to involve you in this transformative journey. And nothing can be done alone. You're going to see all the contributors. There are going to be several of that TTF. There's Leandro, there is Ramon, there is Ramon. And I want to say a special thanks to Bruce that is here with me coming from Fort Collins. And I want to say thank you to all of you.
Thank you very much, Antonio, for your presentation. And we would like to highlight the importance of this handbook, a document which put together science and practice, and present us a good literature review about the theme associated to practical table tennis exercises to be applied with this population with neurodegenerative conditions.
Thank you.
Voilà, merci beaucoup. Il y a un guide qui est publié par l'ITTF qu'on a vu à l'écran. Et donc, on remercie beaucoup le docteur Barbera d'avoir souligné l'importance de la pratique sportive pour les gens atteints de pathologies neurodégénératives, en signant aussi l'importance de la communication, l'importance de l'effort, dans le respect des capacités de chacun et en prenant en compte leur individualité. Donc, merci encore.
And the handbook is now available for free for everyone. Either scan the QR code, which is in the program book, or download it on the ITTF Foundation website.
Donc, le fameux guide de la Fédération internationale de tennis de table peut être téléchargé gratuitement depuis leur site, ou alors il y a la possibilité de scanner le QR code qui est sur le petit livret du programme.
And now we are happy to welcome Guy Tessot, Chair of the Sport for Health Committee at the French Federation of Table Tennis, who will be joined online with Lucie Coulon, the sports technical consultant of the French Federation of Table Tennis, who is in charge of leading this Erasmus Plus Sports project in collaboration with the Danish Federation.
And hello, everybody. I will present to you the Ping Santé Guidebook, a tool that will create a part of the Erasmus Plus project that we are reading with the Danish Table Tennis Federation called Ping Pong Against Degenerative Diseases. The origin of Ping Santé as the activity is developed in French, comes largely from the work carried out by the French government and the European Union against population and societal changes in expectations and needs in terms of physical activity. The practitioner is less attractive to competitive practice for two main reasons. The practice is restrictive. The French and European population is again and is increasingly presenting functional limitation or chronic illness earlier and earlier. The need for sport practice becomes different. These practitioners need to more for their health to maintain their physical qualities for as long as possible, allowing them to remain independent and, above all, to go beyond the medical framework when practicing physical activity. Table tennis allows you to make or rebuilding social connection by practicing an activity where you play, while you do swim, you do run, etc. The objective of the French Federation was to be able to welcome this new practitioner while receiving the club by offering them a complete tool intended from the practice of Ping Santé. An introducing remarks section always rights and duties to be framed. A table tennis session with two examples of session and about 34 exercises explained. As you can see in I partage my screen up. This. As you can is the French version because English is currently developing. What is interesting on this sheet as the cursor allowing you to highlight the quality work during an exercise. They are always run everyone in one predominates. The adaptations part allows you to put the cursor of the activity of the exercise according to the functional limitations of the practitioner. The other very important point is that of the point of vigilance, which must be correlated with the sheets of the main pathology and content section. The idea is to practice is complete safety while implementing exercises. Thanks to table tennis, we have benefits for the pathology. The physical fitness assessment test parts allow the educator to set up a protocol at the beginning and the end of the cycle and to see the evolution of physical qualities, strength of the lower limbs, strength of the upper limbs, balance, endurance, and flexibility. I show you. These tests were carried out by a panel of doctors from the French National Olympic and Sports Committee and are standardized for the whole of France. Ultimately, the objective would to be standardized that through the European Union for the practice of table tennis via the European Table Tennis Federation. Sorry. Oh. This guide is not exhaustive and was created to initiate and research professional educators and volunteers wishing to supervise practitioners, particularly the public suffering from neurodegenerative diseases. As the activity comes out of the classic practice of table tennis, technical progression, the French Federation had understood that without a technical tool, the club would not in the adventure of pink santé. Use of the guide then can be total or partial. We are 4 times. Times 1, carrying of physical fitness test, begin and end of the cycle. Time 2, sitting a session cycle, at least 1 hour per week, but 3 hours recommended. Time 3, choice of session formats and choice of exercises based on the qualities of be worked. Time 4, a time for stretching and discussion to be chosen from the flexibility sheets. Time 5, the educator partial. The educator comes to choose the exercises according to the session stem. It's important to note that in each exercise, technique is not discussed. All the exercises are in the form of a game. Come and blow soap bubbles to rock on the strokes of an upper limbs, play to music and freeze when it stops to rock on balance, and no. It's important to learn and understand that because the objective is to work on your fitness. In all cases, by playing, players progress in technical in table tennis. Allowing for free play is also essential for practitioners who become autonomous in their practice. La Fédération française. The most telling being the show the activity offered in our clubs for people suffering neurodegenerative disease. I show you a video relating the adventure on the French department of Calvados.
A développé depuis maintenant 7 ans une offre de pink santé. Initialement à destination des personnes atteintes de cancer, l'offre s'est diversifiée au cours des années et s'adresse maintenant aux personnes qui viennent juste pratiquer une activité pour lutter contre la sédentarité, faire une activité bien-être, et s'adresse également aux personnes atteintes de la maladie d'Alzheimer ou de Parkinson qui viennent pratiquer une activité qui a des bienfaits prouvés pour leur maladie et pour l'imitation de l'évolution de celle-ci.
Là, on finit la 3e année. Ils étaient 4 au tout début et maintenant on est à une dizaine de participants. C'est suite à un partenariat au niveau national entre la Fédération française de tennis de table et France Alzheimer. Et ils sont découlés qu'on aurait pu un nouveau créneau. On avait eu quelques demandes aussi de renseignements, donc un peu de fil en aiguille avec le partenariat de France Alzheimer Calvados. Et suite à plusieurs discussions, bon, on a mis ça en place. Donc, ça prend de plus en plus d'ampleur et voilà, on a triplé, voire on pourrait même, je pense, quadrupler l'effectif de base.
On est victime de du succès, de notre succès. Et ce qu'on aime bien, c'est de faire jouer toutes les personnes aidées avec d'autres personnes atteintes de la maladie d'Alzheimer ou avec des bénévoles. Et là, il faut avouer qu'on manque de place depuis quelques mois.
Le but, c'est pas non plus d'avoir aussi un encadrant qui va venir travailler sur ce public-là et se retrouver avec 30 personnes. Comme c'est un public un peu spécialisé, ça demande un peu plus d'attention, surtout avec les problèmes liés à la maladie. Il faut être un peu plus vigilant sur certaines choses, donc on ne peut pas se permettre d'en avoir 20 ou 30 dans un groupe, quoi. Avec un seul éducateur, on va dire.
Ah oui, c'est le geste est assuré. Même pour des gens qui n'en ont pas
Quand on voit le bien-être que ça peut leur apporter et surtout, en fait, les sourires qu'on apporte suite à cette section, parce que ça leur permet de sortir un peu plus de chez eux, aussi d'aider un peu les accompagnants, parce que souvent, on parle des malades, mais il y a aussi les compagnes ou compagnons des malades. Et donc, ça fait un peu du bien à tout le monde. Les bienfaits quand on est éducateur, déjà, ça fait une variation sur le public. C'est vrai qu'on travaille avec des enfants, avec des adultes, avec tout type de public, des compétiteurs, des loisirs. Là, c'est encore une nouvelle approche. Il y a un côté de diversité dans cela et c'est vraiment une approche un peu plus humaine, on va dire, beaucoup plus basée sur le relationnel. On va pas parler de qualité du top spinning coup droit, ça c'est sûr. Mais voilà, c'est surtout quand ils sortent de cette séance-là, qu'ils aient le sourire. Et nous, il y a un côté, voilà, on est satisfait quand on voit, quand ils repartent de la salle avec le sourire. Et voilà, on se dit que le travail est bien fait. Et c'est surtout ça qui est gratifiant pour nous, quoi.
Le comité départemental Parkinson est venu nous solliciter en tant que comité départemental de tennis de table parce qu'il y avait une convention avec la Fédération française de tennis de table. Nous, on a répondu positivement en fléchant 2 clubs, donc Cabourg, où il y a une intervention qui a été mise en place par Didier Gilles, et une intervention aussi sur Cormel, où là, Pierre Lecomte aussi intervient. On va faire une petite boucle, comme d'habitude, là, ici, donc avec les cerceaux-là, l'échelle ici. Ici, on va faire un travail d'appui, déplacements latéraux, d'accord? Donc là, ce qu'on va faire, ouais, avec la raquette à la main, ouais. Quand tu joues ping-pong, tu te déplaces latéralement avec la raquette dans la main. Et quand tu as l'habitude du pas, tu accélères. Quand tu as pris la mesure du pas, tu accélères, c'est ça.
J'ai pris l'activité ping-pong parce que j'en avais fait un tout petit peu quand j'étais plus jeune et puis je voulais regoûter à cette activité. En plus, on est à l'abri, l'hiver c'est quand même commode. Et il y a aussi le contact avec les autres. Ça permet de déverrouiller certains muscles qu'on ne fait pas dans la vie active, normale. Le déplacement des jambes en particulier, où on recule, on avance, on fait sur le côté, c'est ce qu'on ne fait pas dans la vie courante. Là, on est obligé de bouger parce qu'il faut rattraper la balle, donc ça nous oblige. Et je trouve que c'est bien.
Dans cette maladie, on sait que le tennis de table apporte beaucoup puisque par rapport au déplacement, par rapport aux gestes, c'est très très important. Et même des gens qui ont des dyskinésies importantes, on s'aperçoit que quand ils jouent, le geste devient fluide. Donc, ça apprend le déplacement, ça apprend justement à combattre un peu la rigidité et tout. Donc, voilà. Alors, Cormeilles-le-Royal nous a accueillis très, très gentiment avec Pierre, un éducateur qui se met vraiment à la portée de tous parce que ce qui est bien, c'est qu'on est à des niveaux tous différents. On a vraiment des très, très débutants et on a des gens qui avaient joué dans le passé et on s'aperçoit qu'il n'y a pas de rivalité. On essaie tous de jouer ensemble et il y a une très bonne entente. Et puis, ce qui est bien, c'est qu'à la fin, Pierre joue des fois avec les gens qui savent mieux jouer pour que le match soit aussi attrayant pour eux et il se met à la portée de tout le monde. Donc ça, pour nous, c'est bien. Nous, ici, avec Formel, on vient 1 heure par semaine, le mercredi de 10h à 11h, qui est quand même bien avec ce club, c'est qu'il nous laisse toute possibilité pour continuer à jouer. Par exemple, là, le cours vient de se terminer, on aurait pu tout à fait rester et jouer entre nous encore pendant 1 heure. Et il y a des créneaux aussi qui sont ouverts. Il y a quelqu'un qui a un transpondeur, donc qui peut venir même quand la salle est fermée. Donc ça, c'est que du bonheur. Et donc là, pendant les vacances, ça va s'arrêter, mais on a déjà pris rendez-vous entre nous pour qu'on puisse venir jouer.
I finished to the Erasmus Plus project. The guidebook is the main project of the Erasmus Plus project. We are working with the Danish Federation on the feedback from this to compare the benefits on different European populations and to have feedback of the potential benefits. The Danish Federation, including Laszlo Kaspersen, who participates in the World Championship, is working as the research part of the beneficial effect of the guidebook on patients. Thanks for your attention, and the guidebooks will be also available in English version soon on the French Federation website.
So, thank you so much, Lucy, for your presentation. It's so interesting to know about the guidebook associated with videos developed by France Federation Table Tennis for professionals and volunteer coaches, which includes evaluation, tests, main sessions, and time to flexibility and discussion to apply all these sections in promote table tennis for health conditions. So, and I think it's so interesting to know about that and to know about the Erasmus project in the end related to this development.
Voilà, donc merci beaucoup à Lucie Coulon pour sa présentation du programme Ping Santé, dont le but est, on l'a compris, d'établir du lien social et de maintenir une activité physique. Et donc, elle nous a présenté un livret guide qui est destiné aux professionnels et aux entraîneurs pour organiser la pratique sportive. Et on a aussi vu dans sa présentation, comme dans les 2 autres interventions qu'on a eues un petit peu plus tôt aujourd'hui, l'importance du sourire et de passer des bons moments en fait en jouant au tennis de table en groupe. Voilà, merci.
So, sorry, we also have Guy from the FFTT over here. So in case anyone has a question in the audience for Guy, he'll be able to answer as well. So please reach out to Guy, or he can also answer right now. So if any questions are there for Guy.
So I have a question. Please share with us about this development of this guide, because it's so interesting. This guide associated with videos, exercise videos too.
Thank you very well. I don't speak very well English. I have a French accent and no an English accent, sorry. The guide is here. Lucy make all this for you. And we have 12 specific illness, okay, for the educators. We have now 400 educators, and we have 70 club for Parkinson and 40 club for Alzheimer now. And we are beginning 3 years ago only. Now we want to continue and make better that now. Thank you, and sorry for my English.
Thank you so much for your participation. And ladies and gentlemen, I would like to thank you for your participation during the morning session. And I would like to remind you, our afternoon session starts at 2 p.m. Thank you so much.
I also have one announcement. So Dr. Antonio has to leave after lunch. So in case there are any questions that you have for Dr. Antonio, those who want to stay back can stay back for the next 10 minutes and ask Dr. Antonio some questions in case y'all would like to do so. Dr. Antonio, if anyone has any questions, please reach out to him. We can even have him answer any questions to you online as well. So please, you have a question? Yeah, okay.
Thank you, Doctor. I listened attentively and I see the passion, the emotion, and you have when you talk table tennis and Parkinson. I want to ask, can some of these ideas of training patients with Parkinson be transferred to other illnesses? Transferred to other illnesses? And the second question, we realize that the people we train for table tennis with Parkinson, we already discovered them. How do you at first sight determine?
How do you?
At first sight, determine that somebody has Parkinson and needs to start playing the game?
Thank you for your question. So we are offering table tennis also to people recovering from stroke, from ictus, from stroke. We have 2 people with the cerebellar strokes. We have people with something called ataxia. They cannot move. Their cerebellum does not work. We have also a 12-year-old girl with cerebral palsy. She lives in a wheelchair, spastic cerebral palsy. I was answering last night to an Italian group in Pavia, south of Milano. They want to offer that to a lady with myasthenia. It's a muscular condition. Yes, ping pong, table tennis can be used for that. So table tennis is, in my opinion, is a form of neurological rehabilitation. Now, if an athlete, a skier, or somebody needs to go under surgery, their physical therapists or their orthosurgeons say, well, start exercising your legs before surgery so your recovery will be quicker. Well, we call this prehabilitation. So if somebody, I say, it doesn't matter the stage of your condition, like for example, for multiple sclerosis, I am called relapsing remitting, I mean, I have attack occasionally. Other people are called primary progressive, means they don't recover from the attack. So when I say any stage of your condition, Parkinson, people with Parkinson are classified in different ways, and they have a number. So I say that the number doesn't matter. You are welcome. At any stage, we want to work with your brain in the attempt to avoid a progression of your condition, to avoid another attack. So not only as rehabilitation, but prehabilitation. That was the first question. So the second question is this. When somebody walks in the room, in our handbook, we say, okay, look at the person and see the way this person is walking. Is walking on a walker, on a wheelchair, on a stick, and see the way he or she moves her legs. Stiff or deambulating, and what's happening with their limbs, what's happening with their face. So that is why, in my opinion, it's important to educate any coach, say, okay, who is that person? Of course, now you're gonna start acquiring information. The same way a coach sees you and you just do your elbow and your wrist like this, he's gonna come and say, well, don't do that. So he needs to also learn how to recognize somebody. And the first thing I do when I shake the hand of somebody, I say, okay, can you shake my hand? How are you? Good morning. And so the first thing I feel is, how powerful is the forearm of this person? Is she grasping my hand? Where is the crease over first and second finger going? Is she staying like this? Is far away? People with Parkinson sometimes hold the paddle far away, they lose the paddle. So when I look at them, I look at their eyes and engage, and I say, oh, nice to meet you. Look how relaxed you are on your shoulder, on your forearm, and your wrist. That's the way we play. And we call this the shake hand. And this crease of your hand is gonna go on your paddle. Can you do that? And look at my index and my thumb. They are right here. I don't shake your hand like this. I don't shake your hand. I don't go back. So let's keep this line. And I give them a paddle and say, oh, why don't you use your index? Your index is gonna always point to the floor. So they need reference. How am I holding the paddle? Where is my hand in the paddle? They sometimes don't know. They hold the handle like this. So now from this 1 minute interaction, you already received a bunch of information. And the more we educate ourselves, I was foreigner to the Parkinson community. So I learn from them every single day, from each of them. I'm learning from the other peer like me with MS. I'm learning from the caregiver from the dementia. So it's up to us to educate ourselves, to be curious, to be emotionally involved. I want to do something with you. And so it's really up to us the way I can give you any recipe, but if you don't like to cook, you're not going to cook. And so it's really you and I together are going to decide, okay, give me more salt, put some more water, give me more tomatoes. And that's when the community is building. Thank you, though.
Morning, Dr. Antonio. I think you're doing some exemplary work in the world of recovery from Alzheimer's and Parkinson's. We as a family have a hospital in Mumbai, and we were wondering if you'd be open to some sort of a dialogue, collaboration, learning, because I think we can probably do something similar in the city of Mumbai. There's enough room for people in this world to improve upon. So sorry, it's a very direct question, but...
I love direct question, and I'm going to give you the direct answer. I'm open to that. Great. Actually, I have a friend of mine that is a scientist in Dubai, and he told me, Antonio, why don't you open up a European program here? And I told him, I need to learn more about your local reality. How many people do we have with Parkinson? How many people do we have with Alzheimer's? What's your reality? What are these people doing for that? I cannot invade or say, I am the best. No, I need to work with the community. So I would love to do that. And we do this with several hospitals, with several memory care facilities, with several independent living facilities. So it's based on the population that I'm dealing with. If you want, on the conditions, the first one is always human being, that I will use this technique. And before I let you move, I need to make sure that you are not, I will teach you how, you in a different way that I will work with her, how to move forward, how to move backwards. I tell them, I pay 3 people. One, they push you forward from your chest. One, they pull you back from your back, because the moment your weight goes there, you are on the ground. So if my shoulder, my elbow, and my feet are lifting up, I am on the ground. So fall prevention. So working always on this forward balance. I would love to be involved with you. Thank you for your question.
Great. I'll reach out.
Thank you for being direct.
After the session.
Absolutely. Thank you.
Hi, Antonio. I listened your presentation, very compliments for very easy to understand. I would like also to ask, because sometimes to have a reference to have young guys to play together. So it's a beautiful, for reason. Today, I saw few young people during this day, and so I think that they can give us also the energy, the motivation to do something, and so why not also to involve the school, the students. So I talk about not primary, but intermediate school. So to play with there, because the example can give us, could be interesting, and could be also have a good relationship. You can create a community, very community in this way. So for example, in Italy, I think about a lot of church, you know, a lot of church, then sometimes go to close, go to not have organizing something to involve. So I think that a lot of church could be also have a tiny stable inside to create for the community a way to communicate and also play and to have after the celebration. And I think that in other place where you're not the religion, but I think it could be easy to find some place when to map, because it's important to create a map of the place. And Franz Parkinson was fantastic to create a map. We need to make the same things in other countries to understand where is the request and where is the service to arrive to the people, not to us to place I put in one place, but there is no one, but the people, they need to understand where is the people, and of course to help there to arrive. Also, for the people that have a big problem at home with technology, but of course it's better to go arrive also in not beautiful condition, but I think that it's important to arrive to feel the energy that is stayed together, not by a remote control, because by remote control you lose everything. Thanks.
Thank you, Massimiliano. We have been working with the Puder School District in Fort Collins. We presented this Neuropong program to an elementary school, to a middle school. It took me 9 months to get in touch with the school district, and it was a lot of fun. Why? Because, and that's another section of the Neuropong, Neuropong seems to be very efficient and efficacious for people with attention deficit disorder, for kids especially. Now we have many adults for that. And so I have a specific program I'm working with pediatrician to bring into the school and to counselor, because we can eventually reduce the amount of medication they can use throughout the day. And so they have less side effect from those medications. They're very heavy on these kids. They are heavy on the family. So if we can involve the kids in a fun activity, it's a lot of work because the kids are all over the place. But that's another branch of Neuropong. We are doing that in the Puder School District in Fort Collins. And you asked me something else. Oh, yes, about the community. Yes. And so younger people, I have the youngest of my people living with Parkinson is 16. He was diagnosed with Parkinson at the age of 11 by a pediatrician. He lives in Colorado. He's an Afghan refugee. And a physician thought that he was probably exposed to some toxic agent. So my youngest person with a Parkinson condition is 16 years. And so, and he comes with his sister. So the young community needs to be involved. Unfortunately, money in the US goes to baseball, football, and basketball. And we organized a tournament last weekend, and we had, I call one gringo guy. It's a blonde little kid with long hair. The rest were Asian and Indian, because that's where the sport is. But we are trying to break all these barriers, all this taboo, all this ignorance, if you will. So we want to present, and I'm sure you guys have something that goes in Africa to the kids at different schools. We really want to start early. Why? Because of the brain. That's a developing brain, and we can improve the quality of our brain functions. Thank you.
Salve, una domanda in italiano perché allora, lo sport del ping pong per il Parkinson è uno sport completo, nel senso che non ha bisogno di avere altri sport diciamo, fatti insieme, o può essere completo per tutte le persone?
So the question is table tennis, could table tennis be considered a comprehensive, complete physical activity for people with Parkinson? So there was a big review of an Italian group, actually, on which one is the best physical activity to prevent falls. We do not know. So to answer your question, I will answer to you in Italian as well, is think what table tennis does. We start from the feet. We put the weight, the balance, knee needs to be aligned, quads, glutes, core, shoulder, vision, hearing, mental ideation of a shot, production of the shot, 0.4 seconds. And we're going to repeat it again. So we cover aerobic, we cover balance, we cover core, we cover sensation, we cover proprioception, if I know where my body is, we cover joy, we cover community. So my answer is complete enough. Especially, we use 2 hours. Our classes are 2 hours. So we do 15 minutes warm-up. We propose the shot of the day, and we memorize that. And we keep teasing each other. And I go around to make sure that it's done well. Not because we are creating champion of ping pong, because if it's done well means you're picking up something new. The message is, you have been playing 30 years like this, you're going to change it. Because this, your brain already knows what to do. Me, I always forget to go down with my, so I need to work on that. So my brain is lost. Why don't I present to my brain something new? And that's the message. Sì, l'attività del ping pong è in effetti globale, perché facciamo attività aerobica, controlliamo le gambe, le ginocchia, i quadricipiti, il tronco, l'addome, la trasmissione dell'energia che viene dal basso alle spalle, l'acuità visiva viene controllata, i convergono, divergono, arrivi qui vicino, devi ideare cosa fare, devi arrivare lì in una posizione safe, devi decidere cosa fare e devi finirla. I also had personal reports of people telling me, Antonio, is that possible that my visual acuity improved? My ophthalmologist telling me, you're doing much better. And I told them, yes. So think about what our eyes are doing. We have 6, 7, 8 muscles in our eyes. They go in and out, up and down. Yes, indeed. I'm working with an ophthalmology center to see if we can do something after recovering from surgery. So look at the beauty of this physical activity for our brain, of this sports. It's not simple at all, and it's difficult. We have 2 champions here. To arrive to your level, it took you forever. So why? Because you learned when you were a little kid, but you know better than anybody else how complex this is. And we can introduce layers. I don't use up or down, layers of the game any way we want. I'm sure if I increase the speed, I will not pick up the ball. If you stay slow with me, I will. Tell me, okay, Antonio, stay 4 inches from the line. I will not do that. So there are so many layers that we can introduce. Ci sono molti livelli, strati di attività neurologica che possono essere introdotti con questa attività fisica, moltissimi, dalla velocità al posizionamento della palla, alla ripetizione di quello specifico movimento. So it's a beautiful, for me it's a discovery. It's a neurology book. On top of that, there is psychology, there is communication skills, there is community. So I embrace, when we decide to produce with Leandro this book, I say, oh my gosh, yes, let's do that. Especially because the mission, Leandro said, we want to bring everywhere we can. I say, indeed, let's do that. And so, again, it's available to everybody, can be seen as a PDF, click, see the videos. Was fun for us to produce it. Thank you.
Thank you, Antonio. Renato, here. Thank you, all the speakers. So I'm the founder of Ping for Alzheimer's program, so I know very well the French Federation because we worked together many years. And we helped them to start the dementia program 5 years ago. But also about your first question, lady, about the other illness, the French Federation work with many professional trainers since maybe 30, 40 years. And they have many experience about many illness. And the guide who present also content many diseases. So you can find a very interesting content about cancer, about diabetes, about obesity. And they work in this guide with doctors, with many specialists of only universities, sport and health. And it's very interesting. So I invite you to download it. It's soon in English, and you can find many good exercise and recommendations about all the health and table tennis. Thank you.
Sorry, this is the last one online question. I'm curious whether the exercises or activities he uses, as a new use in table tennis training programs are adapted to the symptoms, deficits of individuals with different neurodegenerative diseases. Each neurodisease has its own symptoms, and I'm wondering whether they have some kind of personalization in his training programs. question and a follow-up to that is he mentioned that he believes the Neuropong program can be implemented in kids with ADHD. Does he have any collaborators in Europe?
Okay. The first one was individuality, yes, and
yes.
the second one was ADHD. Okay,
yes.
Yes, indeed. So we work with each single individual. And again, if I have two people living with Parkinson and I want to send the same message, I will send in a completely different language, in a completely different way. Means there was a gentleman that was unable to toss the ball close to the net. That perception was miserable. So I removed my jacket that was red and I put it on the table. I say, Gil, you cannot touch my jacket. So make an effort. So I introduce music, tempo. We can use four triplets, the way we move, and colors, and a landmark on your body that is always with you when you're home doing something, on the table, lines. So the same concept is expressed and individualized to each single person. I don't care if you remember that we had two ladies on the wheelchair. I work with each of them in a completely different way, and they have the same condition. So I need to adapt. I need to know what they are experiencing. This is my responsibility to adapt and to make sure that they have fun. And the second one, ADHD, we are working with a counselor on the product, not yet in Europe, and I don't know where this gentleman is located.
From Greece, Christos.
From Greece. So I will be working with the Greece community, with people dealing with mild cognitive impairment. Will be lovely. Again, each of us by ourselves doesn't count. Renato, I want to pick up from what you said. We surround ourselves by people expert in music for Parkinson, in adaptive yoga, in what else we have? I try to surround myself, means the program, by experts. I'm not an expert on everything. I am a person that was a physician with a condition. I love the sport. I know physiology, but I need to surround myself with people that know more than me. And that's the only way we can provide a quality service. For me, it's a beautiful thing to provide something. And I need to make sure whatever I provide is not from me, it's from a team of people that are expert in that specific thing. So the more you surround by people that are expert, the better service you can provide. That is our philosophy.
Thank you. Thank you, Dr. Antonio.
Thank you to everybody.
Thank you for extending this session. And
thank you.
Thank you to the audience as well. Thank you. The next session starts at 2 p.m. People online, please join us again. Thank you.
Good afternoon, everyone. Before we proceed with today's agenda, let's take a moment to revisit the key points from morning session. In our morning session, we learn about Be Activity, a program of World Health Organization to increase exercise practice, mainly for women and adult people. And we also learn about Neuropong program and a guide of French Federation Table Tennis to guide us to understand about neurodegenerative diseases and how to prescribe the exercise for this population. And now, for the first presentation, we welcome Hélène Claire, Director of Social Mission at France Alzheimer and Related Diseases. She is to present how adapt physical activities can be offered to patients on a daily basis throughout the country. Hélène, the floor is yours.
Thank you. Good afternoon. I'm not fluent in English, so I will have a traductor to help me during my presentation. So thank you for your comprehension. Donc, France Alzheimer et maladies apparentées. What is this association? Donc, is the only one association in the SILC, maladie d'Alzheimer et les maladies apparentées, qui existe depuis 1985. Nous sommes sur l'ensemble du territoire. Donc, il y a 101 associations qui sont présentes et qui aident au quotidien donc l'ensemble des familles.
Okay. Right. So France Alzheimer, excuse me. Well, you can pretty much read it on the screen, right? A network of 101 associations that work for the people who have the pathology and their families.
We have 4 missions. Soutenir les familles.
So to the families.
Informer l'opinion et les pouvoirs publics.
To inform the public and the government.
Contribuer donc à la recherche, et nous sommes le premier financeur associatif français sur la maladie d'Alzheimer.
Contribute to the research, and they are the first contributor for scholarships when it comes to research.
Donc nous finançons la recherche à hauteur de 2 millions d'euros par an.
So that represents 2 million euros per year.
Et donc nous formons les aidants, les professionnels de santé et les bénévoles.
And they train caregivers, volunteers, and health professionals.
Donc nous accompagnons et nous soutenons les familles. Du côté des aidants, donc ce qui est important, c'est qu'ils soient reconnus et soutenus, qu'ils soient conseillés, qu'ils soient informés et qu'ils soient guidés. Et au niveau des attentes des personnes malades, eh bien, c'est qu'elles soient non pas considérées comme une personne malade, elles ne sont pas leur maladie, mais elles sont une personne avant tout. Et donc, c'est pouvoir les accompagner à mettre en place des stratégies, à mieux connaître la maladie et les moyens dont elles disposent pour garder leur capacité le plus longtemps possible.
Right. Sorry. So this is about taking every single person individually for who they are. And sorry, I'm struggling with the mic. Not see them only as someone who has a disease. I'm losing the connection, I'm so sorry. Est-ce que tu peux juste peut-être répéter la dernière chose? Excuse-moi, je me suis perdu.
Que les personnes malades, en fait, ont besoin d'être reconnues comme une personne à part entière, oui, et pas à travers leur maladie, et qu'on considère qu'elles ont encore des capacités qu'on ne fasse pas à leur place.
And so they still have abilities that can be exploited.
Alors, nous avons plusieurs solutions qui existent, à la fois pour accompagner donc les personnes malades, mais aussi les aidants, et l'ensemble des familles avec des actions qui sont pour les personnes malades et aussi pour les aidants. Donc, vous les avez présentés ici. Il y a des ateliers à mobilisation cognitive, des ateliers à médiation artistique. Pour les malades jeunes spécifiquement, donc on a des programmes de type éducation thérapeutique et un suivi personnalisé. Et je ferai un focus après sur l'activité physique adaptée.
So there are several actions that you can see on the screen right now, but we will focus more on the aspect of physical activity in a moment.
Donc les activités physiques adaptées, donc c'est un axe qu'on développe beaucoup au sein de l'association. Pourquoi? Eh bien parce que ça permet à la fois donc de ralentir, on se rend compte, le déclin de la maladie, mais également d'avoir un bienfait à la fois sur la coordination motrice, sur l'équilibre, sur les praxis, également sur l'estime de soi. Ça permet de rompre l'isolement pour les personnes malades qui ont tendance à s'isoler et à se refermer sur elles-mêmes.
So the association focuses on physical activity for the social aspects, but also the health benefits regarding coordination, autonomy, and physical capacities.
Et donc, nous avons aujourd'hui plusieurs conventions avec des fédérations qui sont donc la Fédération française de tennis de table, la Fédération française de tennis et la Fédération française d'équitation.
So they have several partnerships with associations, the Tennis Federation, the French Tennis Federation, the Table Tennis Federation, as well as the horse riding one.
Donc, je vais vous présenter un film qui justement donc vous présente comment c'est organisé au sein d'un club de tennis de table au niveau de l'activité physique adaptée. Et je me rends compte qu'il n'y a pas de son sur l'ordinateur.
So there's a little bit of problem with the sound on the computer. No sound is coming out. So for this clip, which is going to present their work with table tennis, and we still have no sound.
Au niveau du son, il y a quelqu'un qui peut... Il n'y a pas de son? C'est ça? Ok, bon. Alors, il n'y a pas de son.
So we'll do it without sound. You can do your own sound effects if you please.
Je vais commenter en même temps. Voilà. Donc en fait, le tennis de table donc, est ouvert aux personnes qui sont à un stade léger à modéré, voire avancé de la maladie. Donc là, vous voyez des personnes malades qui jouent. Il y a des éducateurs qui sont spécifiquement formés à la connaissance de la maladie et au sport santé.
So there are specialized educators that receive special training to accompany the people who are at the training center and to propose adapted activities depending on their condition.
Donc l'activité physique adaptée permet, comme je vous l'ai dit, de rompre l'isolement social, donc de créer du lien pour les personnes malades, mais aussi pour les aidants. Ça leur permet d'échanger entre elles, d'avoir un peu de temps de répit, tout en participant à l'activité avec leurs proches malades.
So that type of activity brings people together, creates social bonds, and that includes also the caregivers who get some time off and are also able to meet other people.
Ensuite, c'est également un sport qui est intergénérationnel et qui permet aussi de changer le regard sur la maladie et de créer du lien avec les jeunes, hein, puisqu'il y a des séances qui sont organisées sur des temps communs avec ouverture au public et des temps dédiés donc, pour les malades. Et puis, ça permet de passer des moments et de jouer avec personnes malades et personnes qui ne sont pas impactées par la maladie. Et on se rend compte, eh bien, malgré tout, que les personnes, même celles qui n'ont pas l'habitude d'avoir joué au tennis de table, eh bien, s'en sortent plutôt très, très bien versus des personnes qui sont beaucoup plus jeunes et qui, donc, auraient une meilleure dextérité.
Table tennis is an intergenerational sport, so that allows them also to bring together older people with younger people, and you get players who have a pathology and others who do not. And what we realize is that sometimes the older players with a pathology can actually be better than the younger healthy ones.
Donc il y a aussi des temps d'échauffement avec des exercices qui permettent de justement faire travailler l'équilibre. Donc avec l'avantage, effectivement, voilà, vous le voyez ici, eh bien de limiter le risque de chute, de faire de la prévention également. Et il n'y a jamais eu donc de chute ou d'événements indésirables lors de ces séances, bien au contraire.
So as you have just seen on the screen, there are warm-up exercises and activities that are made in order to prevent any unwanted falls. And so far, there hasn't been any.
Donc, je vais avancer la vidéo.
Let's fast forward.
Donc là, pareil, vous avez un lien vers une vidéo qui vous permet de montrer les bienfaits du tennis santé auprès des personnes donc, qui ont une maladie d'Alzheimer. Et l'idée vraiment, c'est de déconstruire les préjugés, de se dire que ce n'est pas parce qu'on est malade eh bien, qu'on ne peut plus faire de sport. On peut avoir, voilà, dans la représentation collective, se dire que ce n'est pas possible de faire des sports de raquettes, mais on peut aller plus loin, de faire de la boxe, de faire du karaté, de faire du golf, hein, puisque maintenant, donc, avec les dispositifs sport santé, de plus en plus de fédérations donc, forment leurs éducateurs à pouvoir mettre en place tout type d'activités accessibles à tous.
So on the screen right now, you have a link to a video. This time, this is for tennis. And the objective is to break the stereotypes and show people that even if you have a condition, it does not mean that you cannot do any sports anymore.
Donc, rapidement, je vais présenter les autres missions donc, de France à Alzheimer, donc la recherche. Donc, en fait, c'est 2 millions d'euros qui sont dédiés à la recherche chaque année. Depuis, en fait, que nous finançons la recherche 1988, hein, c'est plus de 460 projets de recherche qui ont été financés.
This is about the other missions of France Alzheimer. And one big aspect is funding research. And as you can see, 2 million euros are invested every year for research.
Nous avons également créé un fonds de dotation et nous menons donc un projet de recherche via une cohorte. Donc c'est un projet qui est unique au monde, qui n'a jamais été mis en place. Et en fait, nous partons d'une triade qui associe la personne malade et 2 personnes apparentées afin de suivre l'évolution et l'impact de la maladie sur plusieurs années au sein de cette triade.
So there is a fund that aims to bring together people who have a condition, their caregivers, but also some relatives.
Nous avons également donc une mission de sensibilisation de l'opinion publique et des pouvoirs publics. Pourquoi ? Parce que nous avons cette volonté de faire en sorte que la société soit inclusive, hein, et donc accepte les personnes qui sont malades, les aidants également, et puisse de fait mettre des actions adaptées pour les personnes. Nous avons donc des chartes villes aidantes qui donc engage à la fois les communes et les associations afin de communiquer sur ce que fait l'association et également donc aménager par exemple l'espace public, hein, et former les professionnels, type les agents municipaux par exemple, à avoir une attitude adaptée lorsqu'ils reçoivent des personnes malades.
So as you see, they also have a mission of raising awareness among public opinion and public authorities. And so that includes having discussions with officials in cities to make sure that people who have a condition are included, and training agents to make sure that the cities provide facilities and spaces that are adapted.
Alors pourquoi nous faisons du plaidoyer ? Donc, pour porter auprès des pouvoirs publics donc, la voix des familles, puisque nous sommes une association de familles avant tout, qu'on soit vraiment reconnu comme l'interlocuteur bénéficiant de l'expertise et de l'expérience de l'accompagnement des personnes malades et des aidants, et puis que ça fasse l'objet d'un sujet à part entière avec effectivement des plans dédiés et des financements dédiés sur la maladie.
France Alzheimer aims to act as a mediator between the families and the public authorities to make sure that they can reach the goals that we have mentioned before.
Alors, je vais avancer un petit peu plus vite puisque je déborde un petit peu de mon temps. Donc, je vais vous passer les autres diapos sans les commenter, mais vous les aurez en fait dans le PowerPoint qui vous sera ensuite transmis par l'ITTF.
Okay, so we have to speed things up a little bit, but we'll go over the next slides and everything will be available online, provided by the ITTF.
Donc ça, quand même, c'est des chiffres qui sont importants. Donc aujourd'hui, c'est 1 200 000 personnes qui sont concernées par la maladie en France et à horizon 2050. Donc ces chiffres vont doubler, ce qui nécessite aujourd'hui de mettre une politique de prévention. Et aujourd'hui, ce n'est pas le cas. C'est-à-dire qu'on travaille dans l'urgence, en réaction. Et il manque aujourd'hui donc cette politique qui permettrait d'anticiper l'arrivée donc prochaine de personnes malades sans avoir prévu de solution pour eux. Pour information également, donc France Alzheimer est membre du conseil d'administration d'Alzheimer Europe et fait également partie d'Alzheimer Disease International. Voilà. Donc nous formons les professionnels de santé. Nous formons également donc les bénévoles. Voilà.
So I think we have mentioned before, they train volunteers as well as health professionals.
Voilà, I am finished. Vraiment désolée pour ma présentation en français. Merci pour la traduction. Si vous avez des questions, écoutez, n'hésitez pas. Sinon, vous avez nos coordonnées ici si vous voulez avoir plus d'informations.
Thank you, Hélène. She apologizes for making her presentation in French.
Thank you so much for your presentation, Hélène. It's so important for us to understand better about adaptive solutions for sick people exercise that you develop in your association, and also all actions related to it occurs better, like the formation of professionals to conduct it. So thank you so much. And do you have some questions?
Thanks for your presentation, Leandro, from the ITTF Foundation. My question is, we believe that the sport activities are good for people with Alzheimer. And for us, it's a challenge to bring more people with Alzheimer to the table, as a different with Parkinson's, which is relatively easier. How do you suggest, how do you think should we act to bring more people with Alzheimer to play table tennis? How is the best way to convince them and to make them enjoy our sport?
C'est compliqué de faire participer des personnes qui ont une maladie d'Alzheimer à des championnats, en tout cas des tournois. Pourquoi ? Parce que déjà, au niveau des troubles cognitifs, au niveau des troubles du comportement également, du stade de la maladie, les déplacements peuvent être très anxiogènes, d'une part. Et ensuite, autant il y a le plaisir à jouer, à échanger des balles, et ça on le voit parce qu'on avait aussi organisé un colloque il y a 2 ans, mais la compétition aujourd'hui n'est pas vraiment adapté, puisqu'en fait, hein, c'est les mettre en échec. Et pour certains qui seraient avancés et qui ne comprendraient pas les consignes, ça pourrait en générer donc une frustration et une baisse de l'estime de soi également.
Okay, so she says that it is indeed a challenge, that people who have Alzheimer are reluctant to participate in championship or tournaments. She highlights the fact that that might place them in a position where they would be failing, and that can be difficult for them to accept. And also, yeah, she points out the difficulty in traveling and going on the stage of the tournaments. Yes, self-esteem is a big issue when it's related to a competition. Mm-hmm. Thank you very much. Because it can be hard to understand the rules of the competition. And so that can lead to a certain amount of frustration for the patient.
Antonio Barbera, thank you for your presentation. I want to pick up from where you left. I offer a program for people living with dementia, not only Alzheimer. Perfect. And it's challenging. So what did I do? I talked to people that deal more than me with people with Alzheimer. And there is a nonprofit organization in the United States called Dementia Together. They adopted a method called SPECL. This method of communication with people with Alzheimer was established in the UK 8 or 9 years ago by a lady whose mother had Alzheimer. So myself, as a physician, I was very ignorant about this fantastic and revolutionary way of talking to people with dementia. You were pointing rightfully that people get upset. The moment you confront them, the moment you give them an obstacle that they have no idea how to deal with, they get frustrated. And certain people with dementia may be violent. So the creation of an environment where there is pure fun, even though sometimes they do not realize what's happening, but they are having fun. So competition, by the words, by the way we talk about competition, doesn't apply to them, cannot apply to them. They come and play together. They come and smile together. They come and they don't even know where they are, but they are smiling. So, but the moment you even ask them a question, so in this method, I ask all my trainers to get educated about this way of communicating. I didn't know that. And so don't ask. There are 3 gold rules. Don't ask them a question. The moment you ask somebody with dementia a question, they don't know what to do. They do not know how to react. They don't know where to find an answer to my silly question. And that's the first thing. And so that's probably the most important. So it's up to us to get educated, thanks to a foundation like yours, to what can we do better for them. So we need your help, especially in how to communicate with them. That's the first most important step. So thank you for what you presented to us. I would like to share with you my personal journey that I share with the Alzheimer Association in the United States. And I changed my vocabulary, and I've been saying that in the last 2 days here. I decided personally not to use anymore the word sick, disease, maladie, but condition. That also established a different atmosphere. And when I talked to the Alzheimer Association, the Parkinson Foundation in the United States, they look at me the first time say, Antonio, what are you talking about? But then they start thinking about that. So the positive message that we want to send to these people, also in our words, in our vocabulary, I think will give a better taste to the wonderful message that you are spreading here in France. Thank you.
We don't have time. Sorry. We need to, yeah? One more?
Short, Claude Bergeret from France. Just, I would like to come back to the question of Leandro. Je voudrais revenir sur la question de Leandro parce que je pense qu'elle n'a pas bien été saisie. Leandro demandait comment faire pour faire venir les personnes atteintes d'Alzheimer pour pratiquer, pas pour faire des compétitions. The question is how to attract these people who have Alzheimer's disease or dementia to come to practice table tennis, to play, to enjoy, not to play competition. We are not at the level of competition. Only this question. Ça, on aimerait savoir comment faire, parce que même à la Fédération française de tennis de table, dont je suis issue, even at the French Table Tennis Association I am coming from, there are more clubs involved for Parkinson than Alzheimer, and it seems more difficult. So, c'est la question, comment faire, vous qui êtes à France Alzheimer, comment faire pour qu'on puisse aussi aider plus ces personnes-là, mais juste pour la pratique?
Alors, en fait, je pense que l'activité physique adaptée donc est encadrée depuis 2018 par un décret en France et qui permet de prescrire l'activité physique adaptée telle que par exemple le tennis de table. Il se trouve qu'aujourd'hui, il y a peut-être une méconnaissance des praticiens et des médecins qui pourraient prescrire cette activité, mais également le fait que ce ne soit pas remboursé chez nous par la sécurité sociale. Et du coup, ça peut être un frein à la participation, que ce soit au tennis de table, mais à d'autres activités physiques adaptées. Et puis ensuite, donc, au niveau de France Alzheimer, c'est une action que l'on propose. Les faire venir, c'est aussi chez nous le proposer. Donc c'est pour ça qu'on a signé une convention avec la Fédération française de tennis de table. C'est pouvoir la promouvoir. On parlait de société inclusive. Et c'est aussi aux municipalités de faire en sorte de communiquer également sur ce qui est mis en place et notamment promouvoir l'action afin de faciliter à la fois la connaissance du sport santé et du tennis de table en l'occurrence, sur les bienfaits que ça peut apporter. Donc ça peut passer par des réunions publiques, par des colloques, mais aussi par une sensibilisation des professionnels de santé vers lesquels se tournent en premier lieu les personnes malades et les aidants, notamment pour avoir accès au diagnostic.
So she said that there is a legal framework in this country right now that allows physicians and doctors to recommend the practice of physical activity to their patients. So that is something that we could rely a little bit more on. It's still little known at this moment. So maybe there is an effort to be made here. Also with the communication from the local governments and authorities, the local government could spend more time and resources on communication to let people know what the possibilities are, because quite often they do exist, but they are just not known. So more communication to let people know what is possible. I also forgot, she mentioned that even though the doctor can recommend the physical activity, it's not necessarily covered by Social Security. So there's also a financial aspect that should be taken into account.
Répondu à votre question, c'est...
So thank you, Hélène, and thank you, all of you, about the questions. And now let's move into the next presentation. And through a partnership with the French Federation of Table Tennis, Kevin Rabbit, head of the Studies and Research Department at France Alzheimer's, conduct a study in order to create a technical protocol serving patients and caregivers. Kevin, the floor is yours.
Thank you. Should be working. Thank you for the introduction. So my name is Kevin Rabian, not Rabbit. I do not have 2 years, but maybe one day. I'm a neuroscientist and I'm the current head of the research department for France Alzheimer et maladies apparentées. In the first part, I will briefly present you the conception of our study called SACPAT. I will give you the name just in a little bit. And after that, I will give my voices to the French Federation because Lucy, even if she came, she presents earlier today, she could not come, so I will share a few words on her behalf. So, okay, this one was already presented by Hélène. Just a little bit of concept, France Alzheimer et maladies apparentées, as well as the French Federation of Tennis, of Table Tennis, discussed and tried to develop something for people living with dementia. And so they decided to share their strengths to promote adapted sports for people living with dementia and also their caregivers. And for that, we decided to create specific sports sessions which are handled by trained monitors. Also, it was important for us to co-create a scientific study in order to provide a new insight regarding the interest of the table tennis for people living with dementia. So you might wonder why we, as a patient association, decide to focus on physical activities against dementia, and that is easily explained, as you can see in the bottom part of the slide, that there is a huge amount of scientific data regarding the interest of physical activities for people living with dementia, as well as their caregivers. And when we think about physical activity, why we decide to focus on table tennis? It's also quite simple because table tennis is very accessible. A few hundreds euros can have their own tables, their own equipment, and can practice table tennis at home without the issue or trouble to travel in facilities. Also, it's sports where it's easy to adapt their level of play. So it's the intergenerational aspect of the games that is very interesting because we can think about grandfathers that are playing with their grandchildren, for example, and they can both take pleasure in this shared activity. Also, and for physical activities in larger aspects, there is multiple benefits to it. Here you have some of them listed in the slide with the scientific reference if you want to. So there is numerous benefits regarding different body function, both physical and mental ones, that can also improve well-being, as well as have a therapeutic influence on several conditions such as heart failure, Parkinson's disease, autism, hyperactivity disorders, as well as mild to moderate cognitive impairment such as Alzheimer's and related disease. Also, it was shown that it could help to maintain, prevent, it's maybe a quite strong word, but at least delay the onset of the dementia syndrome. But, and there is a but, there is always a few clinical studies that can show with concrete data the direct benefit of physical activities as well as table tennis on a neurodegenerative disease. I think it's an ancient slide of mine, so I will go a cappella for the next 2 slides. Sorry about that. Right now, the study shows that there is encouraging results regarding table tennis. There is a few organisms worldwide that are working on it. In the UK, created in 2013, there is a BAT Foundation, as well as the it's the Japan Table Tennis Therapy Association that was created in 2014 that are working to promote table tennis for people living with dementia, as well as completing some case report files. So there is some kind of data, but not enough to be able to show the world the proof that table tennis is indeed adapted sport for people living with dementia. Go for the main subject. So our project, our scientific study is called SACPAT. It's a French equivalent of global health of the Alzheimer's patient and caregiver through table tennis. As any kind of clinical studies, we have one primary objective, which is to define the effect of a 3-month adapted table tennis program on the functional capacity of individuals suffering from Alzheimer's disease. We decided to focus on the physical aspects of the benefits of table tennis because it's the one that we are the most likely to see any changes in 3 months. And since during a clinical trial, if your primary objective failed, your whole study failed, even if there is interesting results on secondary objective. As for the latter, for the secondary objective, we have one that will be focusing on psychological and psychobehavioral aspects of the disease and how table tennis can affect that with this 3 months program, as well as an entire objective focusing on caregivers. Now, for the methodology, since we have the ambition to publish this study, we went and asked the greatest researchers in France to help us to conduct this study. So it was decided to do classic clinical trial with a randomized control and multi-center study that will, I hope, help us create enough data and also a rigorous scientific collection of this data to allow us to publish. So we will need around 70 participants in 2 groups. One group will be participate to this 3 months program with 2 sessions per week. And the 70 participants in the control groups that can do their daily activities, such as walking and other kind of activities that do not imply, of course, table tennis. Regarding our inclusion criteria, so we are mainly focusing on people living with Alzheimer's disease at a moderate or severe stage of the disease, because right now the therapeutic aspects of the disease and the innovative treatments that will be coming will mainly focus on people with an early Alzheimer's disease or even without great cognitive impairments. And since it appears important for us as a patients association to be able to answer the need of people in a later stage of the disease, we decided to focus on people with moderate to severe stage of Alzheimer's disease. Right now, we are waiting for the authority to be able to launch the study, and it will most likely start in early 2025. And now I will give voices to the French Federation of Table Tennis. A few words about our coordinator of this project called Pierre-Louis Bernard, which is a doctor in human movement sciences, associate professor at Montpellier, as well as a gerontologist and a member of the NPIS, which stands for the Non-Pharmacological Intervention Society. Okay. So for this study, we have 7 supports club with 14 educators that are trained to handle people living with dementia, as well as two reference for the French Federation table tennis part. Right now, and because it's not my part, I will, excuse me for that, but I will read what was sent to me. The difficulty is to combine a rigid scientific protocol with a practice that is adapted to each patient and each caregivers that are willing to participate to this study. For each participant, we'll do 2 sessions per week during a 3-month period. And the recruitment of the 7 support group was based on 3 different criteria. The first one was the presence of at least 1 trained health PING educators. Another one was the existence of a PING Alzheimer's sections. And for the last one, and it's easy to understand, the ability to conduct 2 sessions per week. Excuse me, here is one sessions of one of the 24 sessions of this cycle of study. Half of the panels half of the panel will practice twice a week, so it's our participant group, when the other one, the control group, will only be able to do leisure activities other than practicing table tennis. So the table tennis group will practice twice a week as a prerequisite for highlighting the benefits of table tennis for people living with Alzheimer's disease. The sessions are complete and precise as possible so that practice is carried out in the same way in any of the 7 sports clubs, regardless of the population of the practice. It's also a necessity in order to avoid any bias. At least try to reduce the bias. Okay, 2 slides left. Very fast, it's important to set key points and invariants during each of the sessions, the key point that you have here on the screen. So the first one is the reception that is essential so that the patient and their caregiver are reassured during the session. Then the warm-up, which is standardized, identical in each session. Regarding specific sessions body, it's part of the program, and we decided to finish with some of the free plays that allow both people living with dementia and their caregivers to enjoy a bit of this free play. And after that, we have the stretching that is also very important. Now, regarding the exercise, that specific exercise that we can find in the program, we are focusing of strength for upper and lower the body, as well as balance, endurance, and also flexibility, which is trained at the end of each session during the stretching part. And to finish, it is necessary that the educator supervising the participants be voluntary and caring. The best technician in the world will have no impact of patient if he does not deconstruct the table tennis activity, as a difficulty for the educator. Is in charge of supervising the study audience is to respect the protocol while constantly adapting to the need of the participant. A list of equipment necessary for practice is notified within the protocol, and many exercises come from the PING Santé Guide written by the French Federation of Table Tennis. Thank you for your attention.
Thank you so much, Kevin. And also sorry about the pronunciation of your last name, the introduction. Thank you. And it's so interesting to know about this study because it's a very robust study design. And it's a challenge study because when involved training sessions and a period of 3 months, 3 months, it's a challenge. So I wish you success to conduct the study next year. And it's a very important to understand the results related to the program that you develop. So it's so interesting. So congratulations.
Voilà, donc merci Kevin. Du coup, je vais juste dire quelques mots sous ton autorité. N'hésite pas à m'interrompre si je dis des bêtises. Simplement, voilà, pour le public francophone, quelque chose. Donc, merci évidemment pour ton travail et pour cette recherche. Donc, tu as souligné qu'il y avait de la recherche qui existait déjà sur les bienfaits du sport. Mais là, on a encore voilà, quelque chose qui fait défaut sur les bienfaits des effets thérapeutiques du tennis de table pour les patients. Et donc, c'est pour ça que cette recherche est importante, justement pour qu'on commence à avoir des preuves scientifiques de ces effets thérapeutiques. Et on soulignera aussi, ça apparaissait sur une des dernières diapos, l'importance, et ça a été souligné tout au long de la journée, des aidants hein, qui sont inclus dans cette étude. Voilà, merci beaucoup.
And I also to highlight the role of caregivers, to include these people in the study. It's so important too. So, and do you have questions?
Yeah, I have one.
Sorry? No? No? Okay, thank you so much. So let's move to the next session, and I will invite an ITTF Foundation member to present and discuss with us about a case study. The floor is yours.
Thank you so much, Taisa. So my name is Kushal. I'm from the ITTF Foundation. I'm the Senior Manager for Strategy and Marketing. My credentials are nowhere close to as good as all the speakers who have spoken so far, but I'm going to take a little bit of your time to just talk to you about a small little case study and something that brings a smile to our face. And I'm hoping it can load now. Yes. So I just want to talk to you a little bit about the foundation programs and how interlinked we try and make it. So we have the Table Tennis for Health program, as you're aware about, but there's something called as the Table Tennis Dream Building Fund as well. And the Dream Building Fund is where we connect with implementing partners all across the world. And we try and connect all of our programs together. So you might have seen a few speakers talk about the World Table Tennis Day, which is another project of ours. And then it's beautiful to see that there are programs coming together, the foundation programs are coming together, and we can do something about it. So that is one of the case studies that I want to talk to you, is about a story from Bulgaria. There's some music as well, which is great. So I'll start with, it's a very short presentation, so I'm hoping you're interested in it. So the story is from Bulgaria, from an organization called Foundation Compassion Alzheimer. And the first slide is about discovery. So since 2016, the Foundation Compassion Alzheimer took part in European campaign called Move for Dementia. So they did a lot of different kinds of movement-oriented workshops. They did and took part in a lot of activities because of the campaign called Move for Dementia. And then they discovered table tennis. They started playing a little bit. And after that, they participated, some of the participants from Foundation Compassion Bulgaria participated in the World Alzheimer's Table Tennis Championships in 2023, last year in Greece. And what they saw is something they liked a lot. And so they applied to one of our Dream Building Fund applications. So they were applying to the Dream Building Fund powered by GSD, which is the Foundation for Global Sports Development. And they applied in 2023, and we really liked the application, and we selected them. And so they started the project. So from discovery stage of just trying out table tennis, coming to the World Alzheimer's Table Tennis Championships, they applied to another project of ours, which is the Dream Building Fund. We work with organizations for 2 or 3 year project cycles. And so they were really into it. They really wanted to make a commitment towards table tennis and helping people with Alzheimer's through table tennis. And so they applied and they got accepted. And now they're like taking it to the next level. So the project kickstarted just 2 or 3 months back, and it is called TT Against Alzheimer's, the Art of Inclusion. So these are some pictures that you can see on screen, which talks about what they did. We also did visit them, and this was in September. My colleague, Yulia Tappendorf, who's not right now over here in France, she leads the Dream Building Fund project. So she visited along with somebody who you might know about, Moncho, who is very famous amongst all of us and who's like the leader of the health festival. So Moncho is amongst us, and I will give him the floor in just a bit. But I just want to also say that always finding a way is the way that they function, and that's the spirit of organizations that we like the most and we want to work with the most. So they did a fundraising campaign for 2 players to join the championships in 2024. And so Compassion Alzheimer Bulgaria, through their fundraising efforts, were able to send 2 players this year, and they're playing right now as we speak. And it brings us immense joy to see that we can connect to programs, we can see such case studies. I'm not going to share names and pictures because we don't want to spotlight individuals sometimes. So we'll just tell you that there are 2 players from the organization that have come here for the World Alzheimer's Table Tennis Championships, and it makes us really, really happy. So like my director said earlier, Leandro, that we are just building this championships. We just have 9 participants this year for World Alzheimer's Table Tennis Championships. And each year, we want to grow it. And like Claude in our audience also said, first step is grassroots, practice. How do we make them practice? How do we make them try it? And then the next step is championships. And though we call it the World Alzheimer's Table Tennis Championships, it's not about, only competing. It's not about the gold medals. It's about coming here, finding the social camaraderie, and seeing people in the same boat as you are and finding a way out. So that's basically the World Alzheimer's Table Tennis Championships. And I hope people online, people in the crowd who are listening to us can understand the concept behind and the idea behind why we do these championships. And like I said, how are they strengthening the project? So the foundation team visited the DBF project, which is of Foundation Compassion Alzheimer's. And the reason this slide says they were meeting old friends, I'm going to invite Moncho, who's in the crowd, to say a few things about the visit that he had in September when he went to Bulgaria. So Moncho, can you please come to the floor, if that's okay? And I think we can give him a little bit of applause.
Hello, good afternoon, everyone. Thank you for this applause. We were there in Bulgaria with this program, and I want to say that there were 3 important points, that it was the beginning of the program, that we were able to have the equipment arrive there, and that we were there doing a capacity building course related how to use table tennis for Alzheimer's, and also how to do communication. So these are the 3 points that perhaps are in my opinion, the best ones, because it was at the beginning of the program. So now the program is running as we saw. And the important thing is that we were visiting 2 different cities, that we were in caregiver centers and we were in elderly homes. And that, as Kusal mentioned before, the beginning was last year. They wanted to use table tennis to reduce the dementia, and that we were doing some exercises there. So that is, I think, the most important takeaway. And the second one is that they are here. Last year they came to Greece, 1 person, and this year they did many efforts, and they were able to bring 2 persons. So they are very happy, they are progressing, and I don't know if we still have some more time or that is the summary.
Thank you, Moncho. So as you see, oh, what happened here? Oh, okay, now we are back. So as you see, Moncho is there in that image, and next to him is Tanya, who's the project coordinator. She's been very active and passionate about the project, so shout out to Tanya as well. And yeah, some more pictures like you see here. And that's Yulia and that's Moncho giving a capacity building workshop in one of the locations. And as you see, there's a lot of preparation that goes on. And Moncho is very famous for his table tennis for development workshops. And we are constantly learning from him. So thank you for this. Thank you. So now with every stage, we are working, improving and making lives better through table tennis and with organizations like Foundation Compassion Alzheimer's. And I want to end this little bit of a short presentation by saying that this was the legacy of the first Alzheimer's Table Tennis Championships. And we cannot wait to see what comes next. But it involves individuals like people like you who are in the audience, who are online, who see value in table tennis and health and see a connection. And we have converted you, or you've been converted by some other reasons, howsoever it is. I need you to now just spread the word and make others also convinced about this. And with that, I just say thank you. Thank you.
Thank you, Kushal. Thank you, Moncho, for the participation. And it's so interesting to know better about the program of ITTF Foundation. And do you have some questions for them? One question.
I'll give it to you. Just also, we are also going to do at around 4:30, 4:45. We are going to also do a session with our director, Leandro, Moncho, and myself, and we'll be open to a lot more questions. So please prepare your questions if you want to. But I give the floor to Dr. Antonio.
Well, I want to thank you, both of you, for the format of this amazing project. This is the message that I think that each of us needs to take home. I try to trickle up, down. It doesn't work for me. It didn't work for me. So now we are trickling down, up. And so how do we open the door? You went to them and you communicate with them. We go around and talk to the senior centers, to the memory care, to the support group for dementia. We cannot wait for something official to happen coming down. It will not come. It didn't come to me in the last 3.5 years. So what you guys did was absolutely amazing. And I find now, after 3.5 years, that that's probably the best way to go. So knock at the door, say, we would like to present this to you. And if you perceive the fun, trust me, they will come to the gym. They really will. The caregiver will be part of the community. So this is, for me, the best model, and I want to thank you for what you're doing. Thank you.
Thank you so much, Dr. Antonio. Oh, there's one more question. Sorry.
Thank you so much. This is not a question, but a testimony. I think I'm here because of the World Table Tennis Day. In the course of you valorizing your program, we had an online program with Maizières talking about table tennis. And after we finished the course, they launched the World Table Tennis Grant. And me from Cameroon, Africa, with my organization, Global Women Emancipation in Sports, we postulated, and I was selected as a promoter for the World Table Tennis Day 2024 in Cameroon. And when this Congress was launched, I didn't know anything about Parkinson, but when I saw table tennis, they said, when you have the brain for table tennis, you should be everywhere. So I said, let me come here. So coming all the way from Cameroon to have more knowledge about Parkinson, it's so important for me. And I just want to say thank you. And through this, we network, we meet other people, and then we learn new ideas. And I think going back to Africa and Cameroon, we shall have more to say about this. And when I came, I had my friend in France. She said she is in France and has not heard about it, and we are here for this Congress. We are learning a lot. It is not just the game, but it is the knowledge that goes behind the game. Thank you so much.
Thank you.
Just we summarize that we are making friends. Now suddenly we have friends from Cameroon, also from France. But I need to tell you that last year in the Congress, we did another friend from Cameroon and Parkinson. And now he has equipment and he has also activities. So let's make this work. And now we have friends and we are connected. Let's connect it all. Yes.
So, ladies and gentlemen, I would like to thank you for your participation during this first part of the afternoon session. And I would like to remind you our next afternoon session starts 3:30 p.m. Have a break right now. Thank you. Let's start our final phase of the Congress. Thank you. In 2023, started a collaboration between the ITTF Foundation and World Parkinson Coalition. The foundation was invited to Barcelona for the World Parkinson Coalition Congress, where the foundation ran a table tennis room with a lot of engagement. With this success, both organizations want to strengthen the relationship. So, we are glad to welcome online Elide Pollard, the Executive Director of World Parkinson Coalition.
Thank you so much. It's such an honor to be here. I appreciate this opportunity to speak to everyone. I will share my screen. I have some slides. Give me 1 second. I trust you can see those. You can see those okay. Actually, I'm going to change that 1 second. Center mode. I hope you can see that okay. Thank you again for that nice introduction. We're thrilled to be here. My name is Elide Pollard, and I am the Executive Director at the World Parkinson Coalition. And I've been invited here today to speak a little bit about our organization. And I'm going to talk about from why to how, the evolution of patient inclusion at the World Parkinson Congress. So just a little bit about us, if you're not aware. Our organization, the World Parkinson Coalition, was created back in 2004 by Dr. Stanley Fahn, who you can see on my screen on the top. He's a world-renowned Parkinson's specialist. And the first World Parkinson Congress was in 2006, and it was really the first time ever that the full Parkinson's community came together. And I don't just mean the international community, I mean everyone within the community. So neuroscientists, clinical researchers, clinicians who are treating people with Parkinson's and people with Parkinson's and their care partners. It was very powerful and very moving. And so our mission, really simply, is that we always want to find ways to bring the community together. So that could be virtually on virtual events that we host, or in person, like at our World Parkinson Congresses. We bring the community together because we believe that by bringing people together, it sparks more innovation, and including everyone allows for more unique dialogues and collaborations, which will help speed up the discovery of new treatments and practices until a cure is found for this very difficult disease. So I think you can imagine that back in 2004, when we said, we're going to host a World Parkinson Congress and we're going to bring people with Parkinson's into the mix, people said, why? Why? Why do we need to bring people with Parkinson's into the meeting? I mean, they're not going to cure the disease. They're not experts at research. They don't know how to treat it. And what we said was, they are experts. No, they're not scientists. They're not going to cure the disease. They don't come up with new treatments. But people with Parkinson's are experts in knowing what Parkinson's feels like. They know what it feels like to have Parkinson's when they wake up in the morning. They know what it feels like when they're going to bed at night with Parkinson's or they're having trouble sleeping. They know what it's like to live with Parkinson's day to day. And they have a lot of ideas and they have a lot of expertise and they should have a seat at the table. We reminded of the doubters, the people who said, why? We said, you know, people with Parkinson's are not just patients. When they're in the clinic, they're your patient. But when they're outside of the clinic, they're not. They're actors like Michael J. Fox. They're politicians like Jesse Jackson. They're nutritionists like Rochelle Flanagan, and mothers, young people. They're professional basketball players like Brian Grant in the US, or Muhammad Ali, social justice warrior. They're Elizabeth Ildal, amazing politician in Denmark, and also an incredible table tennis player. You probably have all been watching her play. Billy, a comedian in the UK. Linda Ronstadt, a singer. Religious leaders, comedians, actors, and musicians like Ryoichi Higuchi from Japan, an incredibly well-known and popular musician. So we said to the people who doubted us, people with Parkinson's are not patients unless they're in your clinic. When they're outside of your clinic, they're experts. And this is what it looked like. We said, you know, right now in the community, this is how it works. It's very linear. The neuroscientists sit in their labs trying to cure Parkinson's disease, and they might speak to the clinical researchers in the blue arrow, but they never spoke to anyone else. The clinical researchers spoke to the clinicians, and they might speak to the patients. And then the clinicians, they saw people with Parkinson's and their care partners a lot, and they would meet with people, but the clinicians didn't really talk to the neuroscientists either. And then at the end, in the purple arrow, people with Parkinson's, they never spoke to the neuroscientist, ever. They didn't even know what they were doing. And a lot of people with Parkinson's didn't really even meet the clinical researchers coming up with new treatments unless they were in a clinical trial. So we said, this model does not work. It needs to look different, right? It needs to look like this. Everyone needs to have a seat at the table, and everyone needs to have access to each other. They all need to be able to communicate to each other. And when we created this is what we created at the First World Parkinson Congress, a space for everyone. What was amazing and what we saw happen when we did this were a few things. One, for the neuroscientists, the researchers, I met a neuroscientist in the hallway and I asked him, how's the meeting going? What are you learning? And he said, it's amazing. I've never met a person with Parkinson's before. And my team has never met people with Parkinson's before. So we're finally meeting people with Parkinson's. We can see what Parkinson's looks like. We can hear directly from the patients about what they need. And we're so moved by this experience. So that was wonderful. But also for the people with Parkinson's, I asked them, how are you feeling being at this meeting with all these amazing neuroscientists and clinical researchers and clinicians? And they said, this is amazing. We get access to these people who are trying to find new treatments for us and trying to cure our disease. We never meet neuroscientists. So for the first time in our lives, we are getting to hear from the scientists and talk directly to them. And I'm so motivated and moved because now my Parkinson's team is much bigger. I never knew they were on my team. Now there's all these people on my team, and a lot of them are young. So I'm so excited because they're young neuroscientists. But what some other surprises they came out of our first meeting were that the clinicians, this group in the green, the nurses, the PT, OT, speech, social work, they were also never invited to the scientific meetings. They didn't have a space either. And yet they're the ones delivering all the care. So they also got a seat at the table. And the clinical researchers, the ones who doubted why we should bring Parkinson's in, you know what happened? Is the people with Parkinson's started to say, why are you doing research on that instead of doing research on that? Because what you're researching, say tremor, I don't care about tremor. What I care about is that I can't sleep at night or that I'm really tired. could you focus your research on something that's meaningful to me? So for the first time, the clinical researchers said, oh my gosh, people with Parkinson's can help me direct my focus of my research. They can help me prioritize what's important. So this is how things started to change. In 2010, we took our second World Parkinson Congress to Glasgow. We had people with Parkinson's this time on the stage, not just in the audience as learners. Now we had people with Parkinson's in the program, speaking from the stage, sharing their experience, sharing their expertise as patients. And what happened, this is a great example. Sense Park. Dr. Walter Matzler is a movement disorder doctor in Germany. He was so moved when he saw Tom Isaacs, a patient advocate, speaking from the stage, that he said this quote below. My Parkinson's framework was based on clinical observations. And really after he saw Tom speak, he said, I understood immediately that this was not the true Parkinson's. So Dr. Matzler went back to Germany. He created this Sense Park project. He called Tom Isaacs and said, I need a patient advisor. Will you join me? And Tom joined him and helped advise this entire project with a wearable device to track that measure Parkinson's symptoms. Amazing, a patient advisor. That wouldn't have happened before this WPC. And in 2016, we had a World Parkinson Congress in Portland, Oregon. And this time, some new research came out. So for the first time ever, there was research published on shame and Parkinson's. And how did this happen? So Julio Angulo, who is a person with Parkinson's, on the left, and Paul Crack, a professor, Paul Crack, who lives in Switzerland, were put together to host a roundtable discussion on the topic of shame and Parkinson's. It had never been discussed before. But Julio, who lives with Parkinson's and identifies as Latino, said talking about Parkinson's was very shameful for the men in his Latino community, and he felt he needed to address it as a clinical psychologist, also living with Parkinson's. Those two people teamed up afterward, and they went on to actually write papers about shame and Parkinson's and discuss the impact of shame and embarrassment in Parkinson's. These had never been covered before, but because we brought a neuroscientist and a person with Parkinson's together, this emerged from the Congress. But if it had stopped there, that would be enough. But you know what happened is Professor Paul Crack went on with his team to create a SPARC scale, an actual scale that doctors can use in the field to help measure and validate the level of embarrassment and shame that person with Parkinson's has. So if it's a barrier to good care. So now there's a new tool that doctors around the world can use, and it was created by a person with Parkinson's and a neuroscientist and clinician. Amazing outcome, right? So there are other things that have come out of these meetings. I'm going to touch on a few things because not only were the communities connecting across groups, right? The neuroscientists, clinicians, clinical researchers, and patients, people with Parkinson's were crossing. So for the first time, people with Parkinson's from around the world were coming together. They were sharing their experiences in their regions. These two great groups are just examples. PD Avengers, a group started by 3 people based in Canada who live with young onset Parkinson's. It is now the largest patient-designed, patient-led organization in the world looking at Parkinson's, trying to end Parkinson's. They are leaders in trying to ban a chemical called paraquat around the world because there's evidence that's starting to show that paraquat could be one of the causes of Parkinson's disease. They're leading that, a patient-led organization. And Parkinson's Africa, started by Omatola Thomas, a young woman in Nigeria, from Nigeria, who lives in the UK, started Parkinson's Africa to bring the African Parkinson's community together. So new organizations have been created as well. And I'm going to wrap up here on My Moves Matter, because I think some of you may know about this mobile app. Because of our meeting, Rochelle Flanagan, a nutritionist and young woman from Ireland, attended the World Parkinson Congress in 2019 in Kyoto, Japan. And at that meeting, she discovered there was no research about women and Parkinson's. And she said, I'm a woman and I'm having problems with my Parkinson's medications over the month. As my hormone cycles change, as I go through menstruation, I have menses, my meds don't work right. Who's doing research on this? No one. No one was doing research on that. So Rochelle said, I'm going to do research on that. And she found researchers to work with her. She created a mobile app called My Moves Matter. It's an app women can download to track their symptoms and their hormone cycles. It's so impactful and so incredible that Rochelle was awarded the winner of the Health Innovation Hub Ireland Award in 2023 for her technology. This is being led by a person with Parkinson's because she had an opportunity to meet with researchers in an interdigitated space. So how? I mean, the reality is how we've come from why. People don't ask why anymore. Why include patients? Now they're asking how. How do we include patients in a meaningful way? So my only advice really is to make sure that people with Parkinson's have a seat at the table. If they have a seat at the table, then their voice will be heard in a meaningful way. And when you ask them questions, listen, right? For the neuroscientists out there, of course, we have 2 ears and 1 mouth. Let's use them in that proportion. When a person with Parkinson's comes and joins the group, listen to what they have to say, listen to their questions, listen to their feedback. And just a reminder for those of you, our next World Parkinson Congress is in May of 2026. We will be going to Phoenix, Arizona, and it will be open again to everyone. And I would be thrilled if those of you there would consider coming. We will be collaborating again with the International Table Tennis Federation to have a table tennis room and even a table tennis tournament before the Congress. So we're very excited to invite you to join us. I thank you for this opportunity. I will stop sharing, and I'm happy to take any questions that you might have.
Thank you so much, Eli, for your presentation. And do you have some questions?
Ms. Pollard, thank you so much for what you share with us. My name is Antonio Barbera. I used to be a gynecologist, and in the last 3.5 years, I switched to neurology because of my MS condition. But I work with a lot of people with Parkinson. I designed a Neuropon program where we offer table tennis as a form of prehabilitation and neurorehabilitation. And I was not aware of the steps that your association did. In my craziness, when I train my trainers, I have a session, a specific session, where I invite people with Parkinson, I invite people with multiple sclerosis, because as you were saying, when we talk about a condition, it's a chapter, it's a paragraph in a book. But the reality that each single individual lives with this condition is completely different. So we have always this panel, I invite them, I say, please be yourself. And I ask them, can people ask you a question? Because our trainers, our person that eventually will interact with people with this condition need to know about these unique individual experiences. So I felt crazy the first time, and I was kind of afraid to ask my participant, would you please be willing to share your personal experience? And of course, I was reassuring them, nobody will attack you, it's just you as a person. And I always put myself first. I always share my experience as an ex-physician, as a patient, and as a human being, as you were saying earlier on. Okay. And so I really value what you did a long time ago, and I appreciate what we are continuing to do. And this is the way, I think, to involve all of us. So thank you.
Thank you. That's great. I love to hear those stories. That's wonderful. I will say that the story I shared about Julio Angulo, the person with Parkinson's as a clinical psychologist, and Professor Paul Crack coming together, it may or may not surprise you, as you just shared, but he, when we asked them about their experience, they were both very nervous to work together. Professor Crack said, I've never sat on a panel with a patient before, and I'm afraid I don't know if it's going to go well. And Julio said the same thing. He was afraid of working with a neuroscientist, but they just started talking as two humans with a common goal. And they met each other and became not just co-collaborators, but I do believe they became friends. And I think it's just a reminder, we're all just human. And sharing our experiences is so valuable.
Thank you so much. Do you have more questions? Yes?
Good afternoon, Madam. I'm Victorine from Cameroon. I listened with keen attention with what you just said, and I just have a recommendation after being a participant for this Congress. I realize we are talking a lot about Parkinson, and you said there's a Congress in 2 years' time in Arizona. And I realize equally that while the Congress is going on with a lot of sensitive and messages for Parkinson patients, they are on the other side playing. I'll suggest that they all participate in this knowledge, because once they are educated more about their health situations and how they can come out of it, then they go to play, they will be better, and they can easily encourage others who are not even tennis players to be involved in organizations like this. So that is just a little recommendation I have to make. Thank you so much.
Thank you. Wonderful. Thank you.
So I would like to emphasize some topics that you share with us. It's too important, this initiative, to put together Parkinson community, including neuroscientists, clinical researchers, clinicians, and people with Parkinson's diseases. It's so interesting, so important. And also what you share with us related to development of a scale to measure shame in Parkinson's disease. And finally, the new organizations was created from your organization, so it's so interesting. So thank you so much for your presentation again.
My pleasure. Thank you.
Effectivement, merci beaucoup à Ila et Pollard pour cette présentation, qui nous a parlé du congrès organisé par la World Parkinson Coalition. Et donc, en fait, ce qui en ressort, c'est qu'il est extrêmement important, en fait, d'inclure tout le monde, non seulement les scientifiques, les personnels de santé, mais aussi les patients, en fait, pour mettre en relation les différentes strates, et notamment, en fait, les gens atteints de Parkinson avec les spécialistes en neurosciences, parce qu'en dehors, ils n'auraient sinon pas réellement d'opportunité de pouvoir communiquer. Et en fait, c'est important parce que ça permet de mieux définir les priorités de la recherche. Et comme résultat, on voit aussi des initiatives qui se multiplient. Notamment, nous ont été présentées plusieurs associations ainsi qu'une application. Donc, on voit vraiment toute l'importance de ce dialogue entre les différents acteurs.
So, moving to the next presentation, moving on to a success story of the Congress and why we have such an event to initiate collaborations. Last year, the World Table Tennis for Health Festival was held in Greece. A follow-up to it resulted in an Erasmus Plus sport project, which the foundation is now a part of. Please welcome Konstantinos Siakos, President of Hellenic Sports Club for Physically Disabled People, and Christos Komas, Researcher and Project Manager, KTG Researcher and Innovation, to present their project.
Hello, everybody. I am Konstantinos Siakos. I'm the president of the Hellenic Sport Club for Physically Disabled People. PASCA, it's the short name. And here with my colleague, Mr. Goumas, we will present this project, the SWAN project. This was an idea that we had last year during our participation on the health festival that was in Creta, in Heraklion, in Greece. I'm also an ex-Paralympic athlete. I was a table tennis athlete and a wheelchair basketball athlete. I have a spinal cord injury. And during that participation, we had this idea for the project. The project is, I don't know if I must share my PDF or you are having, okay, no problem. The project is SWAN. It's the spin for well-being active lifestyles through therapeutic table tennis for individuals with neurodegenerative diseases. SWAN is a project for 26 months. It is an Erasmus Plus sport project focused on promoting health active lifestyle for people with neurodegenerative diseases, mainly Parkinson's and Alzheimer's, through table tennis. The project also aims to build a network of stakeholders to support the adoption and expedition of similar projects. How everything is started. Everything is started during the World Table Tennis of Health Festival in Creta, in Greece, in Heraklion, in 2023. That was the beginning idea for everything. Our project partners are ITTA Foundation, is the Federation of Table Tennis of France, is the University of Ljubljana, is the Foundation Comparative Alzheimer from Bulgaria, is KTG Research and Innovation from Cyprus, it's Alzheimer Leon from Spain, and it's Pasca from Greece, which is the coordinator of the project. Few words about our club, who is the coordinator. The Hellenic Sport Club for Physically Disabled People was founded in 1987 in Greece. He is based in the biggest public rehabilitation center in Greece, in Athens, and is the first sport club for disabled people in Greece, and we operate several sports departments, including athletics, wheelchair basketball, swimming, table tennis, shooting, fencing, archery, and para-taekwondo the last years. The main idea began in 2023. In our club, one of our strong departments is table tennis department, and we had the experience for many years working with young athletes with cerebral palsy. With the help of our head coach, Mr. Polychronis Politsis, who had a program how to improve their physical situation, their balance, and their activity with special training in table tennis. That was a program that was working for many years in our club, focused mainly on people with cerebral palsy. In 2023, in collaboration with the Hellenic Table Tennis Federation, we launched a Parkinson Table Tennis unit under the supervision of our coach, Mr. Politsis, and the main initiative was to create and participate in the World Table Tennis for Health Festival in Crete. During our effort there to work with people with, actually the most people who was with Parkinson's disease, we see, and to participate in the festival, we had the idea that using our experience and our project for people with cerebral palsy to work for people with Alzheimer and Parkinson. And now with our participation in the festival, we earned many valuable experiences and inspired to create SWAN project. We had the opportunity to speak with many people from many different countries to gain many experience and ideas. And all that with our experience as a club and especially in table tennis, and how table tennis help to improve the health of many different diseases. We had the idea to create this project with our partners and to have the opportunity to work with a new field for us. That was people with Parkinson and Alzheimer. With the help of our staff, our coaches, and our colleagues like Christos Goumas, we had the opportunity to have a project in Erasmus Plus. The project was awarded from the European Union, and we believe at the end of this year we will have the official beginning of the project. Now I'll call my good colleague, Mr. Christos Goumas, to share with you more details about our project.
Yeah, hello everyone. Kostas, thank you for the introduction. I will say a few words about the specific of the project. So when we started developing the SWAN project, we identified several critical needs that guided this planning. So these needs represent both the rationale behind creating the project, but also the foundations that are necessary for the project to be successful. So one of the first things that we realized during the World Table Tennis for Health Congress last year was that different countries were implementing like different programs, but we didn't have something like a systematic effort and a structured table tennis program that would be implemented like across different countries at different scales, different settings. So one of the first needs that we have to cover was this, to create like structured table tennis for health programs. And in our view, this required to have together people from different disciplines like sports scientists, neuroscientists, doctors, coaches, and of course the people who live with a neurodegenerative disease to make these programs. The second need that we identified was that okay, most of the clubs that are implementing these kind of projects, they don't have the expertise on how to approach table tennis training programs for people with neurodegenerative diseases. So we needed to create something that is tailor-made to the symptoms and the deficits that those individuals have. And also this gave rise to another need. Okay, those people, they find like a local sports club and they go have some training. But how do we ensure that the coaches know what they're doing, know what kind of training they should implement? That is like specific to the symptomatology of these individuals. So this gives rise to the third need, which was about training the coaches. And what I mean by training is not only about table tennis. It's also about educating them about the diseases. So what is Parkinson's? What are the main symptoms? What happens in the brain? What those people can do and can't do. So we saw a need in the theoretical aspect of neurodegenerative diseases, but also on the practical level on how to adapt their current training programs to people with neurodegenerative diseases. The fourth need that we identified was that we needed to find like a standardized way to measure the impact of such programs and at different levels like cognitive, social, physical, and see how these programs can be effective and at what level. And the last need that we identified was that we had to raise awareness about table tennis for health programs. We wanted to make sure that people are aware that apart from like taking their medicine, apart from the pharmacological treatment that is intended for this kind of diseases, they could also engage in physical activity to improve their condition and change the way they live. Yeah, so to address these needs, we structured the project around several key actions. So one of the things that we're going to deliver as part of the project is we are going to create a best practices report. It will be mainly on the countries that participate in the project, but of course we can include best practices from other countries as well. The second thing that we are going to do is we are going to create a training curriculum for trainers, As I mentioned earlier, this is going to include theoretical aspects of neurodegenerative diseases, but also some practical things about the training and how we can create something that is adaptive to the strengths and weaknesses of those people. We are going to create two table tennis for health curriculums. The one is going to target mainly individuals with Parkinson's, and the second one is going to target individuals with Alzheimer's. We are going to also create we are going to implement these curriculums in 3 project countries, Greece, Spain, and Bulgaria. And we aim to recruit at least 50 people with neurodegenerative disease to participate in these interventions. As I mentioned earlier, we are going to create a standardized metrics assessing physical, cognitive, and social aspects, and do something like pre-post measurements before and after the interventions to see how these programs change aspects of people living with neurodegenerative diseases. And the last one is that we're going to deliver a guidebook which will inform the current practices and relevant stakeholders in this space, and with aim to extend the reach of the project and the impact of the project after its end. And the last thing that we aim to do is that we are going to participate in the World Table Tennis for Health Congress in 2025 and 2026, and we have also agreed that some of the people who are going to participate in the interventions, they are also going to participate in the World Table Tennis Alzheimer and Parkinson Championships. So we have close ties with what the ITTF Foundation is organizing for us each year, and we would like to take advantage of these initiatives. Yeah, so this work is organized around 5 work packages. Each one is supporting different stages of the project. The first working package is about like the bureaucratic stuff, ensuring that all components are aligned and on schedule. The second work package, we will conduct some kind of research to better understand the needs, also some best practices, and we are also going to do a literature review on physical activity interventions for people with neurodegenerative disease, with an emphasis on table tennis interventions. On WP3, it's about creating the curriculum and the resources that will serve as the foundation for the program. In the fourth working package, we are going to train the trainers, we are going to implement the curriculum, and we are going to evaluate the outcomes to see whether this curriculum is effective and at what level. And the last WP is about communicating all the things that we have done. It's all about community, it's all about sharing, it's all about making public the work that we have done. This is the purpose, and see the change that we can make in this space. Yeah, so here is a snapshot of what SWAN aims to achieve in numbers. So as Kostas mentioned earlier, we have 7 partners from 7 different countries in the EU, and we will work together for 26 months in order to implement and evaluate the program. 5 work packages, 13 deliverables, 1 guidebook that will share best practices and guide future programs. Best practices report, we're going to train trainers on implementing this curriculum, both in the practical terms of implementing such programs, but also on theoretical aspects of neurodegenerative diseases. 2 table tennis curriculum tailored to the strengths and weaknesses of individuals living with neurodegenerative diseases. And we will recruit around 70 individuals, maybe more, with neurodegenerative diseases to participate in the interventions program. Yeah, we're going to have 3 transnational project meetings. The first one is online, the second one is in Slovenia around the end of 2025, beginning of 2026. And the last one is in Athens, who is coordinating the project. Yeah, so this was from my side. Thank you for your attention and for allowing us to share the SWAN project with you. We are at the moment we are in the process of finalizing the grant agreement with the European Commission. As Kostas mentioned, probably like within the next month, we expect to start the implementation of the project. Yeah, and as we look forward, last year we met some people, we had discussions after the Congress, and we made this project a reality. At the moment, we are preparing new proposals for the next year. So if anyone is interested or would like to collaborate or learn more, feel free to reach out to us for the new proposals. And I believe, yeah, we have built a community. It's the the second year that I'm presenting at the World Table Tennis for Health Congress. I'm very happy to be here. Hope that I will present next year and the year after. Yeah, thank you again.
Thank you so much, Konstantinos and Christos. And just to highlight some key points of your speech, it's so interesting to know better your project. And I emphasize some topics that's related to you are planning to create a 2 structured training curriculum tailored to the needs of neurodegenerative diseases. You are also planning to develop around 60 coaches. This is so important to implement the process and to evaluate the patients based on physical, cognitive, and social levels. So it's a holistic way to see. And also in the last phase to develop a guidebook to share with the stakeholders. So congratulations, it's a very, very impressive project.
Voilà, merci beaucoup à nos 2 intervenants de Grèce qui nous ont donc présenté The Swan Project financé par l'Union européenne. Et donc, c'est un projet qui vise à promouvoir l'activité physique et sportive. Ça a été lancé, vous l'avez vu, à la suite du festival de l'an dernier. Et en fait, comme on vient de le dire, ils se sont rendus compte qu'il y avait vraiment un besoin d'organiser et de structurer pour répondre aux besoins des patients atteints de maladies neurodégénératives. Et donc, il y a un programme qui est beau et qui est ambitieux, qui consiste à identifier les pratiques utiles, formaliser l'entraînement, y compris pour les entraîneurs eux-mêmes, créer des structures, aussi évaluer l'efficacité du programme et au final produire un guide. Donc, vraiment une belle organisation et un beau projet. On les remercie beaucoup pour tout leur travail.
So, thank you so much. And let's move into the last part of our Congress right now. And I would like to again invite Leandro Vec, ITTF Foundation Director, for a special moment to show gratitude to one of the Foundation's biggest supporters.
Thank you very much, Thaisa. And this is a token of appreciation that we would like to provide to the main sponsor for this event that started this year, and that's Ultimate Table Tennis, a very innovative way of playing table tennis professionally, and that I would like to invite you to watch. That is every year progressing and improving, and it's a professional league in India. And would like to invite first to to give this token of appreciation to Princess Sina Rashid, and to our newly ambassador. You have a new task to perform. If you can come to the stage to handle this appreciation to Ultimate Table Tennis. If you can. Yeah. Just here. I would like to invite their leader, Ms. Vita Dani, to receive this appreciation.
Few words. Few words.
Would you like, sorry, Ms. Dani, would you like to say a few words? Yes.
What I've learned today is that we have 2 ears and 1 mouth, and we should use it to its proportion. But of course, all of you are welcome for Ultimate Table Tennis League, and I really look forward to host all of you here. Ekansh, please make sure you invite everybody. Thank you so much.
Thank you, Ms. Dani. And I would like to invite my colleagues from the ITTF Foundation. Yeah, Kuchal, if you can join me. And also Moncho Ortega Montes for a closing last part of this session for some conclusions and also for some Q&A. And yeah, so I think it has been a great two days. Taisa, thank you very much for moderating. And there are some conclusions and some takeaways that we can collectively take. But from my side, initially, we have a presentation from UNESCO where a message at the takeaway I could remark was the need to change the way we have a narrative with not only with the sport community, but outside our sport community, and how to reach those outside our own circles, and not only reporting about our numbers and about quantity of players and quantity of events, but also on showing the change and the impact that we can have in the life of the people. I see how we all preach the benefits of table tennis, which I would say we agree, and how beneficial is table tennis, but this should be demonstrated. And that's why there is a need also for scientists and academic institutions on how table tennis can be beneficial, and show the facts and show how can we improve in this area. Kushal.
Yeah, thank you so much, Leandro. I echo what Leandro is saying, and what we want to do with this session. It's a bit informal, while we are dressed a bit formally. What we want to do is invite questions from the audience, and we want to try and make it a little more intimate in that sense. And that's why we have our health impact manager over here, and our director, and myself as well. So if there are any questions for the foundation about the health festival, about the Congress, about anything about the foundation or table tennis for development space, sometimes the idea of table tennis for development is sometimes misunderstood, or not, sorry, I misspoke, not misunderstood, but it gets a bit confusing with table tennis development. So there is a little bit of a difference in that. And so we are here to take the questions. We are here also to address any issues, challenges that you might have. Obviously, we are taking feedback from all the players. We are encouraging them to do so as well. And to see some of the steps that we might have taken, learnings from last year to improve this year, might have not worked, might have worked. So we want to try and understand from the players and people who are attending. So please, if you have any questions, please let us know. Otherwise, we can carry on and give you more and more information of us. But then it doesn't become a dialogue, it becomes a monologue.